Um, I just have loved working with her in the Writing Center. She's a Writing Center consultant, and she's a tremendous asset. So this moment is bittersweet for me because I'm really proud of her, and I'm so glad she's graduating, but I don't want to let her go. So now I'm going to read Professor Burwell's intro because she was so great. She also sent an intro, so this is a double intro for Lauren. Lauren's thesis, which she will be presenting today, involved tremendous work and commitment over the course of this academic year. In this process, Lauren researched and wrote up a succinct literature review, built an online survey, and collaborated with Dr. Burwell in analyzing data which she interpreted and discussed based on a topic she is passionate about. Lauren's thesis has built on and extended the extant research in childhood adversity by discussing the important role of sexual orientation and gender identity in moderating health outcomes. Congratulations on a great project. That's from London.
You can click through like this. I need my notes. Oh, yeah, please.
Okay, thank you guys for coming. So I did my research project on the sexual orientation and gender identity moderate the relationship between child adversity and health problems.
Is it clicking? No. Is there a way to turn it off? It's on, and it's connected. It might be dead. Okay.
Well, I can just pop back behind there, turn it everything.
Do you want me to go through it? Do you want a clicker? Like a human clicker?
Oh, sure.
Catherine, you want to be a human clicker? Yeah, great. That way Lauren can face the audience.
I was kind of hoping I could hide back there. Okay, you can move on. So I'm going to be using some different abbreviations and terms throughout my presentation that some people might not be familiar with.
Okay. Can we have you use the microphone?
Sure.
Otherwise, the live streaming doesn't capture it. So will you stand here, and then Catherine's your live clicker. We're just figuring this out as we go, folks.
Well, now I can't see, but okay, that's okay. So I don't need to necessarily read through them all, but I just wanted to give you guys a bit of a background of what I'm going to be talking about and some of the terms you're going to hear. All right. Thank you. Okay, so adverse childhood experiences, or ACEs, are events that occur between the first 18 years of your life that can be potentially traumatic. In the 1990s, Kaiser, a health corporation, worked with the CDC to conduct a study on ACEs and the link between different health outcomes. So they found that around 61% of adults reported experiencing at least one ACE, and that 1 in 6 people have at least 4 or more ACEs. This study aimed to describe the association between child health adversity and health risk behaviors and disease in adults. So since the original ACE study, there has been numerous amounts of research that have portrayed the same results, that have consistently found that having more ACEs results in different health issues. And some studies also looked at possible moderators for this relationship, but something that hasn't been examined is sexual orientation and gender identity as a moderator. LGBTQ individuals in general are at higher risk for suicide and mental health problems because of the discrimination, harassment, prejudice, and the violence and just hate that they experience. Those who are LGBT have found, LGBTQ in general have had also higher scores of ACEs, but those specifically who are trans have had more ACEs than people who are lesbian, gay, bisexual, and heterosexuals altogether. So given that ACEs and LGBTQ status are associated with more mental and physical health problems, the current study wants to identify if the correlation between ACEs and health problems is moderated by LGBTQ status. Okay, so my research hypothesized that a combination of having higher ACE scores and identifying as LGBTQ+ will result in more disease conditions, depression symptoms, and health risk factors. Okay, so for my methods, we were able to get 186 Westfield State participants. The goal was only 100, so thank you if you're in this room and you participated. We asked their age, their race, and their sexual orientation and gender identity. For the purpose of this study, I am showing that 34.5 identified as LGB plus and 9.2 identified as gender diverse. And just for some clarification, gender diverse is anybody who is not cisgender, which is their gender assigned at birth. So that would be people who are transgender, people who are non-binary, gender fluid, and all the other identities that are out there. So for the procedure, we used 4 different measures. People used a survey that was sent out through the psych department for extra credit, so thank you if you're Professor Morrison, he's in here. So I just wanted to give a brief explanation of some of these studies. So the ACEs questionnaire, which I've already talked about a little bit, but it is a 10-item survey that assesses the occurrence of early child adversity. It touches on neglect, household dysfunction, and different types of abuse, whether it's emotional, physical, or sexual. They're yes or no questions. If you are to say yes, that's a 1, and you score it up at the end. And if you have 4 or more on the ACEs, that is considered to be a high ACE score. Okay, so assessing risk factors. The original ACE study that I had talked about from the 1990s also assessed risk factors, and they found the 10 most leading causes of mortality. We chose 6 for this study, and some of these were smoking, severe obesity, physical inactivity, depression, multiple sexual partners, and a history of STDs. For disease conditions, this is also studied in the original ACE study. We adapted it from a primary care clinic's questionnaire for adults. We didn't want to use what was in the original study because a lot of the conditions weren't necessarily made for college students. So we adapted that to look at things that people our age more likely experience, like migraines, sleep apnea, stomach ulcers, but research has shown that it can also lead to further down, ACEs lead down to further issues like heart conditions, stroke, cancer. So hopefully that doesn't happen to anybody, but and then finally, the Breck Depression Inventory. So depression is one of the most common mental illnesses in college students, so that's what this study mostly focused on in terms of mental illnesses. And the Breck Depression Inventory was used, and that's a widely known questionnaire that's used for depression. There's 21 items on it. I used only 20. We excluded the question on suicide for ethical reasons. And there you can choose 1 through 3, 0 through 3, 0 being, like, for example, I don't feel sad, where 3 would be the highest of sad feelings. Okay, so I want to get into my results. I wish I could see it a little better so I could point out it to you a little bit. Well, I'll go up there, if that's okay. I was dichotomized the ACEs into low and high. So as talked about, the high scores are 4 and above, and low would be 3 and under. For this, those individuals who are LGB plus are the blue line here, and you can see that as they were higher and ACEs and were LGB plus, then they had more disease conditions.
Do this. You're like a rock star.
Okay, so there was not a significant correlation between the BDI scores for those who were LGBT plus, which is okay. Didn't meet my hypothesis, but that's okay. Same for health risk factors. There was not a significant correlation here. But going for gender identity, similarly, just like sexual orientation, disease conditions were more prominent if you had high ACEs and were gender diverse. For BDI mean, we actually got some unexpected results. So actually, if you were gender diverse, your depression lowered as you had higher ACEs. So we thought that maybe a possible explanation for this is that those who are gender diverse receive treatment because of their high ACEs, and for being gender diverse, because a lot of the times if you do transition, you have to go through a lot of therapy to do that as well. So maybe their treatment resulted in less depression, and for future research, maybe treatment could be a possible moderator. And then for health risk factors, there was also not a significant correlation. Okay, so hypothesis supported, a little. If you had a high ACE scores and were LGBTQ, you had a higher chance of having disease conditions, and that was true for sexual orientation and gender identity. So with the lack of certain hypotheses having correlations, we decided to look at main effects and not accounting for sexual orientation, people who are not accounting for sexual orientation, people with high ACE scores had higher risks for depression and for health risk factors and disease conditions. And then non-accounting for ACEs, those who are LGBTQ had higher in ACEs, disease conditions, health risk factors, and the disease conditions, the health risk factors, and the depression. So some limitations was that the study was self-report and cross-sectional. So a future direction would probably have multiple reportants on people. So it would be if I took the report, but also my mom did, who happens to be here in the audience. That would make so that the correlations were stronger, and cross-sectional, that's kind of more of like a quick study that's easier to do, where possible, I'd like to do something more longitudinal, so maybe people in the early adolescence, middle adolescence, and then emerging adulthood, and look at those different results. Because typically, a lot of the studies show that the early ACEs make it so you have more health problems, in your future. So it would, just be nice to, well, not nice, but it would be interesting to see the differences in the different times. So, why this study? Originally, when I decided I wanted to do a senior honors project, I knew I wanted to do something about mental health and something with the LGBTQ community. Both are very important to me. I myself am in the LGBTQ community, and for mental health, I've had my own issues, and I also want to go into mental health counseling. But I also want to bring, it brings a lot of attention to different things as well. Just doing this study and bringing awareness to not only LGBTQ students, but all students. I think usually you see results that are college students are at higher risk for depression and different things, but this results is on your students, your friends. To show some of that was 77.9 reported having anxiety, 52.6 reported having depression, 40% had a household member who attempted suicide or was mentally ill, and just all these different statistics. They could keep going on and on. I mean, one of your friends, 20.5% reported physical abuse, there was sexual abuse. So just remember to be a good friend, and then you never know what somebody's going through. So it's just really important for me to do this study and make awareness. So acknowledgements, my committee, they have been amazing. Professor Burwell, who's in London, Catherine Savini, my clicker, and she's a lot more than just that. And Green Evs, who was my library liaison, which was awesome. They were all great help. All my participants, I think some of them are in this room, and the professors who offered extra credit, again, thank you so much. And then if you keep going, my references. I did include some of the correlations and data for some of the psych professors that may or may not have shown up, which one did. And sometimes they like to look at the numbers. I would have included this for all of you, but I don't think you would understand. But that's okay. I don't even always understand it, but yeah. So, do you mind just clicking through some of it? And then I did just want to be able to show that the different percentages for race and age that were included, because those are also important factors, and I think that further research could also pay a lot more attention to race and other marginalized groups. So thank you for listening. Okay. Hope nobody has questions.
Mark, how would you like audience members to ask questions? Should we use this mic or?
I've got one up in the front.
Perfect. I will. Okay, so we have time for questions for Lauren.
It's okay if you don't have any.
Oh, I can just. Oh, leave it here. It'll pick it up. Oh, you got it.
Thank you.
Trust the experts. Questions for Lauren.
I'll make a comment. So on Monday, we're having State Senator John Velas on campus to talk about mental health. And one thing he's looking for is actual data to support funding for the campus. So so it's not just awareness that you're bringing, but if you were to potentially send this to myself and Kaylin, we're working with John Velas on this, we can get more funding for the campus on mental health. So I think that's
awesome. I will definitely do that. Yes, I heard about that. I'm definitely going to attend. I think it's really important, and not just, I think mental health is also not looked at enough. Like, we try to advocate for it much, but not everybody is willing to talk about it still. It's still stigmatized. So the more that we can bring to campus, the better. Thank you for your comment, and I'm glad that this is going to help that out. Yes?
So I think this presentation is very timely. I think it's on a lot of great points, but I will say that I was super impressed with the number of participants that you were able to gather. So I'm just curious, what maybe your strategy was there.
Extra credit.
That's your motivator.
Professor Burwell, my advisor, she never offers extra credit, but because this was my project, she was kind to do that. So a lot of students wanted it, so that was amazing. But that could also be considered a limitation, people more participating in this because of the incentive, but it was still appreciated. I would love to have an even bigger population because, again, there was only like 9% that were gender diverse, which is only 14, which in light of normal statistics, that is a decent amount, but I would still like a broader, bigger range for more diverse results. Because I definitely feel like with more people, then the results would have had more correlations.
Was there any part of the result that you were truly surprised by?
I guess the part that said was unexpected, but I think that the explanation of possible ability that they had more help could definitely be a reason for that. Levi?
Do you have any ideas on how to get more people of color to fill out surveys like that?
I feel like talking about if it was focusing more of it on being for people of color. Like, I think that my study, it advertised being LGBTQ, so I think I know a lot of people who were LGBTQ are like, oh, I want to do that study. I know I mentioned it in QSA, which Levi's the president of. And a lot of people were interested in doing that because it's something that's personal to them. Like, this study's personal to me. So I think just if we could redo this study, and I'm going to be going to grad school here, and maybe do something more. Yes.
So I'm wondering, you picked depression to study specifically. The full majority of your participants, regardless of how they identify and gender identity, majority endorse depression and anxiety. Do you have any hypotheses about any more nuanced diagnoses? So, for example, like personality pathology that you that you, if you were to do this again, looking at another set of diagnostic criteria, that you might expect to see more psychopathology in this population. Is that anything that you'd be interested in studying, or thoughts that you might have? I know you didn't look at that specifically, but looking at more nuanced psychopathology.
I forgot about the microphone, but yes. Well, right now I'm in your abnormal psych class, and we are learning a lot about different mental disorders that I don't think are necessarily talked about enough. A lot of times it's a big focus on depression and anxiety, which, yes, they're super prevalent, but there's also a lot of other disorders that need to be talked about as well, and I'd love to do more like research on maybe looking at them more individually, especially borderline personality disorder. I think that is something that a lot of people actually suffer with that's not talked about enough, and that needs to be brought awareness to.
Okay, let's give our presenter one more round of applause. All right, so we're just in a transition period now. Our next speaker will begin promptly at 10:30. being patient with us. We just go with the flow, these kind of things. Our next speaker is Nathan Solitario, and here to introduce him is his primary advisor, Beverly Army Williams.
Thank you, Hillary. About a year ago, Nathan contacted me to set up a meeting to discuss the possibility of my working with him on his senior honors project. He had such a clear vision for his project, a novella grown from a short story he had written years before. We began our work that summer before we needed to. I asked Nathan to read several novellas and to begin considering structure and how the novella is different from a novel. And last fall, we began our work in earnest. I set Nathan a weekly word count, and each week we met to discuss elements of fiction craft, such as point of view and character. We referenced Sharon Ord-Warner's excellent craft book, Writing the Novella, to guide us, and discussed the many novellas Nathan had read in preparation for this. Each week, I would read Nathan's new pages, and I was impressed to see how adeptly he incorporated my feedback and our discussions of craft. At some point during our meetings, I would always make sure to ask him, how did the writing go? While some writers might complain about demanding word counts, Nate never did. Instead, he'd share, with that special sparkle in his eyes he gets when he's pleased, how he was finding it easier and easier to return to the page and to the world he was creating. This project is so special for many reasons. It was important to Nathan to bring in his understanding of psychology, his major, and to be ethical in how he wrote his characters. His other committee members, Dr. Rebecca Burwell and Dr. Nick Morrison, guided him in those areas. Nate will share his other goals for the project as he reads from his novella. I'm so proud of him for how he met these goals to create a fun-to-read, deeply moving, meaningful novella. I have no doubt that we'll all have a published copy of this book on our shelves before too long. I'll close with a quote from Toni Morrison. You must write the book you want to read. Nathan has done that with skill and grace, and I'm delighted to invite him here to share his work with you.
Thank you very much for that. Hello, everybody. My name is Nathan Solitario, as you are aware of by this point. And this is my project titled The Mystery Squad, a novella on dysfunctional and found families. So, of course, when you're making a project like this, it's a bit outside what is usually presented at these symposiums. So, you got to ask yourself, what is this project? What purpose does it serve in the greater scheme? And why this particular format, the novella? And my answer to that is that me, myself, growing up, I had some difficulty with coming to terms with some relationships that just wouldn't form, some emotional distress that I was under as a child in some dysfunctional relationships. And the media that I turned to never really reflected that in an accurate way. There was always, towards the end of many young adult or YA fiction or even children's media, where the solution to every familial issue was either tied up with a pretty little bow at the end, or the person at the other end of the dispute was an irredeemable monster. This is not reflective of normal and regular relationships, and I wanted to sort of represent that ambiguity in this work. And in particular, why is it a novella? Part of it is selfish. I wanted to write one. But another part of it is that I am an English minor, and I wanted to sort of put my money where my mouth was, in a sense of speaking, of showing how you could exemplify that accuracy with the entertainment benefits that a novella would be able to communicate, and not a novel, because those are long and scary. So, development of the project went as thus. There were 4 major components. There was the research side, which involved a lot of psychological literature on adolescent development, how they cope with stress, how important media is to them. There was a number of studies that used novellas and short stories as a form of therapy for young adults and teenagers. There was audience awareness, being aware of how to communicate these ideas to people using various examples such as Coraline or The Fault in Our Stars as a sort of reference point to how to communicate these heavier topics to younger audiences. Literary models, as I've already discussed, but also novellas such as Fahrenheit 451, Of Mice and Men, those types, analyzing how they function, how they deliver their messaging, and also personal influences. You can see right there the town of Russell, Massachusetts. That's where I was raised for a majority of my childhood. I'm pulled between Middlefield, Mass, and Russell, but this is where I grew up and where a lot of developmental stages occurred. And I brought a lot of that with me, difficulties with my father, difficulties at school, and I wanted to bring those personal aspects to the project itself. So here are the characters of the story. I drew these guys a long time ago, but I redrew them for the purposes of this presentation. On the far left is Rebecca. This is primarily her story. She is a teenager, 17 years old, junior in high school, and she is struggling with detachment from her mother and has a sort of avoidant attachment style with a lot of people in her life, including her friend Lenny, who is right beside her in the center. Lenny is more of a happy-go-lucky guy on the surface, but has a lot of struggle at home with his father. He communicates his turmoil with helping others before himself, which leads him to some rough patches, but he keeps the plot moving. And Bianca is sort of in a sense, she's a secondary character, but she is always there to sort of be the voice of reason, kind of helping people through. And a lot of my counseling research went into her and her style of speech and how to diffuse conflict. So, without any further delay, I have some excerpts from the novella itself, and I'm going to be reading them to you with some examples. This is a chapter, this is a bit from a chapter with Lenny that shows neglect and abuse, which has problem behavior, social isolation, and instability and uncertainty in the home as the primary things here. And context, Lenny has a garden of which that he keeps very tidy, and that is his safe space at home. Partway through the weeding, a sound struck Lenny's ears like a needle. It was a slow rumble of a rickety car engine and the hiss of brakes. His dad was home early. It felt that way, at least, even with the sky tinting red. Lenny tried to ignore it, but almost like his dad was monitoring him from the car, the man thumped open the gate to the backyard with a cigarette in one hand and a lunch pouch over his shoulder. He lifted the brim of his trucker's cap and called out, "Hey, flower child." Lenny avoided eye contact at the comment and kept to his work. "Yeah? Didn't you get enough of that over the summer?" He took a drag off his cigarette and talked through the smoke. Lenny didn't say anything as his dad continued. "Checking on your mom?" "Yeah, she's fine. Sleeping. Thank God." He walked across the back and snuck a look at the garden, then to the rest of the yard. "I'm going to need to pull you away from the pansies this weekend. Car's acting up again, and I want to get that other piece of junk running." Lenny winced at the thought. "Are you sure you need me for that?" "Why do you think you're here? I'm your dad, now quit whining." "I'm not whining. I'm just asking for trouble. That's what you're doing with that attitude." He flicked some of the ash off his cigarette and took another huff. Lenny went a bit quiet. "Now I'm going to go watch my tapes. Don't you bug me." Hearing that, Lenny just nodded. He wasn't looking for a fight since he rarely, quote-unquote, won. There was a moment of quiet after the clack of the back door. Even his mind lulled to a calm as the anxiety passed. The spark to keep the garden tidy dimmed. His hands palmed at the leaves trying to figure out what to do, but he was out of his groove and the darkening sky only deterred him further. After a few more false starts, he swatted his gloves off and packed up. So as you can see, Lenny was distraught, immediately thrown off of things that he enjoyed, instantly into a state of defense, just in general. very uncomfortable around his father and the way that he talked to him, very verbally abusive. Here's an example of Rebecca's avoidant attachment, forming cautious connections with other people, is emotionally distant, and often puts on a standoffish attitude when confronted with relationships. Bianca obviously didn't know what to say, but neither did Rebecca. So she fell back on an old strategy to calm her down, being stern. "Hey," Rebecca said, voice deep and flat. Lenny looked over and smiled. "Oh, this is Rebecca. I told you about her already." "Len, I can introduce myself." Now dial it back and let her breathe. He looked a bit shocked, but then apologetic as he nodded and stepped backward. Rebecca tried to look as non-threatening as possible, but after shutting him down like that, it was going to be difficult. She cleared her throat and looked up at the girl with an attempted softer look on her stiff face. "So, hey, I'm Rebecca. Guess you knew that, though." Bianca adjusted her collar and ran her eyes up and down her body. She seemed to be analyzing her style and vibe, something Rebecca was all too familiar with. "So, yeah, sorry about Lenny. He's just excited about the whole club thing." "Oh, no, it's fine. I just get a bit, overwhelmed sometimes." Bianca looked at Lenny, then to Rebecca, with her nerves seeming to settle as the air thinned between the three. "I'm Bianca, by the way. I don't think I mentioned that yet. Nice to meet you." Rebecca thought for a second, Bianca fidgeting a bit as she did, and Rebecca said, "Well, look, I'll give it to you straight. You don't have to join the club if you don't want. We just figured that you might be interested. His Lepetit is advising if that helps your decision at all. If what Lenny said has got you interested, we have a paper for you to sign. And we can get this thing going. If not, don't feel like you owe us anything." So as you can see, Rebecca is very much on the fence, on her toes, sort of keeping behind. Even to her friend Lenny is a bit rough and rugged and kind of pulling back, as it were, to sort of present herself in a more tough and standoffish light. So, another symptom of this abuse cycle is anger management, internalizing emotion. A lot of teenagers, they can't express themselves verbally, so it goes inward, and they start expressing themselves physically. And this is an example with Rebecca when confronting her bully on the bus. Rebecca stood up. "You take that back." "Make me." Rebecca's blood boiled and she started walking across the aisle. It was then that the bus driver looked at his rear view and saw Rebecca out of her seat and called over the noise of the bus. "Asher, sit down, or you're getting a bus card." "Yeah, Asher, sit down," Mariah said. She trembled with stiff arms and misty eyes. She grunted and went back to her seat while pushing down her feelings to maintain any sense of strength on the bus. The kids grew quiet and curious about what got the driver involved. It wasn't much longer until they made to stop, but each foot they traveled felt like an eternity with Rebecca's breath in her throat. The bus squealed and hissed, the familiar package store came into view, and Rebecca dabbed her eyes lightly to avoid any obvious redness of mascara smearing to her eyeline. Mariah got up and strutted off in front of her while Rebecca hung back until she was already walking down the steps. The bus driver gave no help, giving her a look that said, "Don't you do that again." Her throat ached, choking on her held breath and as she held back tears. The pressure in her head was starting to give her a headache, and when she stepped into the parking lot, she made sure to stay far behind Mariah. She wasn't looking to fight anymore. She was too deflated and exhausted, but Mariah wasn't like her. So as you can see, a lot of that anger is going within. A lot of it was either explosive, where she started to step up to her, or internalize, where she's starting to hold her breath, get a headache, all these physical symptoms of stress and anger. And finally, we have the importance of an emotional support network. Normally, the best solution for this is to find confidants and people that you trust. You need a sense of social support and a sense of safety, especially as a teenager when you're forming these bonds for likely the first time that are going to last a lifetime. And the context for this is that Bianca and Rebecca are heading to Lenny, where he is in his special hiding spot, which is the train station. Lenny looked up, eyes welling as he talked. "Well, last week I don't know why I did, but I got really mad at my dad, and I talked back to him about the car," and he sniffled. A tear dropped down his chin. And my dad broke all my starters. All my winter starter plants just dead, and all my shells are broken. At that point, he started to hyperventilate. Tears streamed down his face. Bianca went towards him with a hand, but before she could touch him, Rebecca turned to him and embraced him with a sudden hug. She kept her eyes shut as she squeezed him, her own tears beginning to fall off her face and onto his dirty shirt. Seeing him like that tore her apart. She just wanted to be there for him, and while she couldn't fix the garden, she was content with just being there. The longer she held him, the slower his breaths became, and then he felt a hug back, and soon after, a third pair of arms wrapped around the two of them. Lenny spoke up, his words choking his throat still. "I'm sorry, guys. I didn't mean to get all this." "Trust me, I know the feeling," Rebecca said, her eyes opening back to a misty blur. Her hands patting Lenny's back as her body pulled backward. "We got you, man. No need to worry. Do your parents know that you're out here?" "Well, no." Lenny wiped his eyes, Bianca pulling off next. "But to be honest, I don't care. I hate that stupid house." Bianca wiped her fogged-up glasses and asked, "Well, what if your dad figures out you were skipping school?" "He doesn't care. I just need to be home before he gets home." He sniffled. "But I'm feeling better. At least a little bit now." "Well, good," Rebecca said, face terribly stained with mascara streaks. "I'm glad to hear that you're okay, dude. We were really worried about you." And as you can see, that sort of comfort and security that Rebecca has learned to sort of give Lenny with all that he was giving back to her, and Bianca there as a secondary support, really helps Lenny calm down and relax and sort of realign himself. So my final thoughts are that the media that we consume is very important to the people that we become. I know for me, I wish I had some examples like Bianca, Lenny, and Rebecca of how to handle wavering and difficult relationships. The ending of the novella reflects that, where it's an ambiguous ending of where they go, but a happy ending knowing that they have each other as a friend group. And what I really wish for the future of media is to look at these issues with more nuance and more attention, because they are important and kids need it. I know I did. And as a final thank you, I would like to thank my advisor, Ms. Army Williams, Professor Burwell, who is not here, but all thanks to her, and also to Professor Morrison there for being a wonderful batch of guiding lights for this project. It couldn't have been done without any of them. And so, I guess, time for the Q&A.
Excellent. We have time for questions for Nathan.
Yes.
Was the father ever dealt with?
In what manner?
I don't know, in whatever
Yeah.
way you might have dealt with.
Very true. He was not necessarily dealt with. He sort of is still doing what he does, but there is an allusion to Lenny seeking help from the guidance office and reporting the sort of abuse that he's going under. So there's no direct consequence for the father in the novella, but there is an implied one towards the end. Welcome.
Nathan, I have a
Are we good?
question.
Yes, please.
So, like you mentioned at the beginning of your talk, this is not necessarily the kind of presentation or the kind of projects that some people associate when they think of the word research. But there was obviously a lot of research that went into your project. So I'm wondering if you could just speak, especially to, we have some people online and some students in the room who are about to do an SHP. How did you go about kind of combining quote unquote typical research with this very creative project, and what kind of advice would you give to other students who want to be more creative with their project?
Well, the manner that I went about it was that I had a main research idea of, and just a general gripe that I had with media, which was how can we represent this better? And a lot of the research that went into it was psychological in nature and sort of like funneling down that road of, you know, how do teenagers act just generally, and how do they perceive media, and like, is this an important thing to research to begin with? And so my general advice is that if you combine your passion for the research with a coinciding passion for artistic development, then it's just going to happen. Let your passion guide you, and it would help if you had some professionals sort of help guide you representing this correctly. But in general, is more of a matter of kind of covering all your bases and then just moving forward from there and letting that sort of engine in your heart kind of push you forward, as sappy as that sounds. But yeah.
Thank you.
Welcome.
I just want to say that I think you did a really nice job, but I also think that I like that you brought a lot of attention to, like, when you hear abuse, you often think about like physical abuse or sexual abuse, but this is like a lot of emotional abuse too that I don't think gets a lot of attention.
Yeah.
So, so I just want to say you did a really nice job.
Thank you. Yeah, the verbal abuse component, I don't really see given as much weight as physical in media, and I mean, you could call that a symptom of staging for like film and such, but I think that verbal abuse can have just as hard as an effect on kids as physical, if given the quote unquote right hit, you know. And so I wanted to show that with Lenny, especially.
All right, let's
All
give
right.
one more round of applause for our speaker. So our next speaker will begin at 11 o'clock. All right, welcome back, everybody, or welcome for the first time. I am Hillary Sackett-Taylor, the chair of the honors program. And we're going to move on with our next presenter. Our next presenter, Hunter Jordan, is going to be presenting based on his poster just to the left of the screen, so you can kind of direct your attention over there. And here to introduce him is his primary advisor, Dr. Shirley Aqua.
Thank you, Dr. Sackett-Taylor. Good morning, everyone, and thank you for being here. It is an honor and a pleasure to work with Hunter. Hunter was my student in 2 classes, and actually this idea of doing a senior honors project generated from one of the classes, the health communication class. Hunter has been a very studious student. Actually, we started on Zoom. We met on Zoom when COVID came. Very committed. When we started this project, we didn't know where we were going because it involved collecting data, interviewing students, but Dr. Sackett-Taylor gave us a new concept, which is the story core. And I think that this is the first time, actually, right, that a student in the Senior Honors Project program is doing a story core. And actually, the topic about anxiety is very important because we know that students get very, very anxious in balancing academic work as well as school and their life overall. But this has been very exciting. Myself, Dr. Robert Thorne in the back, Dr. Sackett-Taylor, and then our library liaisons all work together, and I would give all the credit to Hunter. He put it in a lot of work. He got his data collected by the end of the fall semester, so the spring semester was actually just doing the story core. So with a round of applause, please let's welcome Hunter Jordan.
Hello, everyone. I present my poster on the left side of the room. I have broken it down into 3 different sections. My first section is methods, second are results, and the third is the rise of StoryCorps. I wanted to start off with my research question, and my research question was, how does academic performance affect college students? My methods of this was reaching through Westfield State students by recruiting them through flyers on campus as well as social media. With that being said, I had 9 students conducted a focus group, was structured by interview questions as well as the guided by discussion. Participants were asked about their note-taking habits as well as their study habits, as well as how they cope with test anxiety. Anonymous recordings were exempt from the focus group and was conducted into the StoryCorps project. On the left or the right-hand side column is a graph. It describes that test anxiety affects 82% of college students, and as well it shows that depression is 63% of students, social isolation is 63%, 61% feels concerned about racism and injustice in the country. 19% have had suicidal thoughts, as well as 60% of students have difficulty in coping with health. These are some excerpts underneath the results from the focus group, and include, I definitely get anxiety before every exams, as well as it said, as well as you feel confident, there's always a chance of you getting a curveball and not knowing what the questions are going to be on the exam. The second one is, yeah, I have definitely have decreased my test anxiety. Oh my God. Focus groups. The third one is, I would always probably say 90% of the time I will have test anxiety before exams, and I definitely have our anxiety before both exams, but definitely worse in person. And the second chart below describes how students feel about test anxiety. This is not my graph. Some students feel anger, some students have headaches, some students have race in the heartbeat, fast or slow breathing, feeling of fainting, the fear, the frustration, feeling of important doom before exams, or inability to complete the exam. On the other side of it, you will see a graph which talks about the students, and I had four students in the focus group that said test anxiety was the worst in in-person exams. I had 3 students say that online exams were the worst. I had 1 student say that they had anxiety in both, and I had 1 student that had no comment on that. From my focus group, I have learned that every student deals with test anxiety differently, as well as how they approach dealing with it. This includes exercising, as well as acupuncture, taking breaks, and anti-anxiety medication. Students reported that professors can decrease their test anxiety by providing study guides. From my focus group, I've reported that students have studied from anywhere from 1 week, 1 week and a half to a week before the exam, but at least they studied 3 days prior to the exam. So here above, I'm going to play some audio clips from my focus group. The first one is how I started dealing with how I have my own test anxiety. I don't know. My second one is about how has my anxiety has changed over time. And my third one is how I deal with my own test anxiety. Going on, the third column is talking about StoryCorps itself. So StoryCorps was founded in 2003 with a mission of preserving and sharing humanity stories in order to build community between people and create more than just a conversational world. Why did I choose StoryCorps? Students with learning disabilities such as dyslexia need more accommodational opportunities to complete the senior honors project. So I used a voice recording as well as primary method of deep data reporting has given me the opportunity to share my knowledge in a more equality and inclusive format. This data could be used for students as well as professors and as well as the Bonacos and tutors and advisors to help students manage their test anxiety. As you can see in the below, there's a QR code to the rest of the StoryCorps. Thank you.
So I just want to say two things before I welcome questions for Hunter. I am really thrilled that I got to be a part of this project because for many years I think there are some students who have been really intimidated by the Senior Honors Project because they thought that it had to be a long research paper. And when I became the director of this program, one of the things I really wanted to do was I wanted to reduce the barriers for students who wanted to do the Senior Honors Project and make it a more inclusive opportunity so that everybody had access to it. And it came really from my own belief that we, as a society, share knowledge in a number of ways. In fact, historically, we shared knowledge through spoken word long before we wrote things down. And so when I met Hunter and he asked me to be on his committee, Professor Aqua and Mr. Thornton and I, we kind of thought, well, what are some alternative forms that this project could take that would honor what Hunter brings to the table and be something that would also have a long-lasting impact. So StoryCorps is an initiative by NPR, and anybody can record their own conversations about anything. It's kind of like a time capsule because all of these conversations will now live maybe forever, in the Library of Congress. And so there will be many, many students who come after Hunter who will benefit not only from the content of his project and learning about it in a verbal audiological way, but also by seeing that the Senior Honors Project can be accessible to all students and that we're willing to work with you and make this project what you want and need it to be. So I'm so proud of Hunter and this work, and I'm really proud to have been part of the first StoryCorps Senior Honors Project. So now, without further ado, any questions for Hunter?
Listening to this actually reminded me a lot of my oldest daughter, who did have a lot of test anxiety. And I would study with her quite a bit, but it would still, once you get into that room.
Yeah.
But one of the things that you mentioned that made me think of, things that she and I have talked about is, how it depends on the professor or how the words are, are worded. And I've always talked to her about, it seems like growing up in school, there's one way of teaching, and if you don't learn that way, then you're going to struggle. It doesn't, mean that, person here is smarter than this person here. It's just a different way of learning or how they process information. So I don't know if any of that came up in your research, but I would.
Yeah, it definitely came up in the focus group. Definitely students were talking about how the way the language was. I didn't put it in the poster, but they were talking about the language itself and how the professors described the questions affect their answers.
Yeah, absolutely. Thank you.
So I'm actually doing my Senior Honors Project on the connection between ADHD and anxiety.
Yeah.
So I was wondering if when you were doing your research, if anything else came up for disabilities with ADHD or anything else that could make the anxiety even worse.
Yeah, my focus group, we didn't really have any connections to that because I also only had 9 students. So I would recommend opening it up a little more. Maybe offer some extra credit. I guess I learned that is a big part of it. But yeah, I definitely maybe I'll come back and want see your project and see the connections with it. Yeah.
Yeah. A lot of what I really latched onto was the accessibility aspect of your presentation, and what that really connected with for me is as an education major, making tests more accessible as well on the teacher side of things. So I was curious if you had any research on different ways to make tests more accessible to reduce that testing.
Yeah, that's a great question. I actually don't have any part of that because I didn't focus on the exam itself. I just focused on the students and how they take exams. But that would be, if you're interested in doing a senior honors project, that would be another great project to spin off of what I've currently done. Professor Aqua?
I just also want to add that when we designed the questions, we had to get IRP approval. So we had stated that in the focus group discussions, as they talk about anxiety, if any of the students who participate and who are participating in the focus group feel like their anxiety level is going high because of the discussion, they could use the counseling center. So I just want to put that out there. We didn't put
Yeah.
them in a situation where the anxiety levels would go up and they would have nothing, no resources available. So we had stated that each student had a consent form to sign and return to Hunter that they voluntarily want to participate in this study. So we had that resource available and listed on the consent form.
Yes.
I mean, first of all, this is a really great project. So many of my students come to my office hours to talk about this exact thing, so it's great that you're looking at this more systematically. One of the things that jumps out to me a lot of times when we talk about anxiety, we talk about breaking it down into multiple parts. So
Yeah.
you have, it looks like, you know, looking at your results section, kind of an affective or an emotional component.
Yeah.
Like a lot of students talk about frustration, fear, anger. There's also the physiological piece, like feeling faint, heart palpitations, headaches. One thing I'm wondering about is the more cognitive component, or the thoughts that students have. In your focus group, did you notice, were there particular thoughts or worries that people had about like the anxiety if they're looking in the future? Like what types of thoughts?
Yeah, definitely. I had some students think about their overall grade at the end of the semester, and how one exam in the beginning of the semester can impact pretty much their career here at Westfield, as well as if they're going to pass that class and go to the next lecture. That's what I got from my focus group. It was very interesting to know. I actually talked a little bit in my focus group and how having a certain GPA for either athletics or honors does affect your test anxiety for myself. Yes. Hey, how are you?
Excellent presentation.
Thank you.
And two questions for you that are similar. One is, like, if you could give students one piece of advice as a result of your research, what would it be? And then if you could give professors one piece of advice as a result of your research, what would it be?
Yeah, for Vesta's one, I would definitely recommend at least having a study guide of some format, because that definitely, as from my focus groups, it definitely decreases the anxiety. And for the students, are you talking about for like the senior honors project, or are you talking about like how to deal? Yeah, so I have some up there of like ways of dealing with it, either like exercising or just relaxing. Also I do acupuncture for mine, for myself. But yeah, that's what I have for mine. Yes.
Did you find in your research that any part of the root cause of this anxiety was the root cause based upon students' inner feelings of not feeling good enough, not feeling smart enough, not fitting in, or that person's way smarter than me?
Yeah,
I mean, it's like I call it the itty bitty shitty committee.
Yeah, that definitely plays a part in it.
And you have to learn how to shut that off.
Yeah.
Because it will never adjourn.
Yeah, that.
It will wake you up in the middle of your sleep.
Oh, yeah.
Or in the middle of a shower in the morning and start feeding you all that. Well, it's bad information.
Yeah, definitely. That definitely came up in the focus group. I had many students talk about that itself, and they didn't really describe how they dealt with it, but they did talk about that itself of like having bad thoughts in the morning, or waking up at night and having a bad thought about the exam the next day.
There is an on and off button, by the way. It's easier than
All right, let's thank our presenters one more time. So while we're in this transition period before our next presenter begins at 11:30, I really want to strongly recommend that all of you scan the QR code on Hunter's poster. That will bring you directly to the StoryCorps website where our conversation lives, and you'll be able to listen to it at another time, I hope. It is about a 35-minute conversation where Hunter and I kind of reflect on our own personal experiences of anxiety and tie it into his research and his focus groups. And there's some clips from the focus groups in there. I'm really, really proud of the StoryCorps conversation, and I'm just so happy it's going to live on forever. So please do scan the QR code and listen to that conversation when you get a chance. And we'll be back at 11:30.
before the world stopped for a while, she was in my honors Intro to Criminal Justice class. And almost immediately, I knew how fortunate I was as a professor to have this smart, energetic, intelligent, eager, curious human being in my class. And I don't often compliment people highly. It's just who I am. So take that for what it is. Autumn and I, that semester, would have sidebar conversations where she was always recommending to me the new true crime podcast or serial killer podcast. And at the time, you know, that was her passion, this interconnection between criminology and psychology. And her enthusiasm was contagious and is contagious and made me want to be a better instructor, right? That after 20 plus years doing what I'm doing, to step up to the plate in a very different way. It's easy to get lazy. It's easy to not care, but she made me want to care. And as Autumn academically grew, she moved to trying to understand the system, professional behavior, and barriers to justice. So when she decided to focus her honors project on the topic of psychological testing used in law enforcement hiring, it was the perfect fit for her areas of interest. Autumn's project is an incredibly forward-thinking project, and you might not understand the significance of what she does here, but she explores assumptions about pre-hiring testing in law enforcement and how they link to assumptions about what makes a police officer a good police officer, and she considers how to better align the two. I probably had Autumn do far more than she needed to do, but she met with leaders in the law enforcement field, police chiefs, people who had run homicide units. She talked to three very high-level professionals. They're people that I happen to know professionally, and afterward, they all commented to me how she got them to think about their own hiring practices. All three. And all I'm going to tell you is, as my students asked, how do you make change in the world? It's those little steps. It's by explaining your knowledge and sharing that knowledge with others around you in very compassionate but passionate ways. So with that, Autumn.
Hi guys, I'm pulling this up on my phone so I can see it because I can't see the screen right here. Does somebody want to be my clicker?
Oh, the clicker works now.
The
clicker
works. It does?
This clicker works.
Oh, so I can walk over there?
Yeah. Oh, no, you have to use the mic.
Okay. Sorry. So my topic is hiring. So I say good police because that's what the word they use in the literature, but I don't like the word good. I think it's too vague. And I examine psychological examinations, and I use the words psychological and personality interchangeably in this because that's how it's used in the literature for the sake of brevity. So thank you, Dr. Tobin, for being my mentor through this whole thing. Sorry. So why this topic? I chose this topic sort of formed itself. I wasn't exactly sure at first. I knew that I wanted it to be based around police reform, and I knew that I wanted it to involve psychology. So I started with examining assessments available for personality and psychological.
Sorry, I don't mean to interrupt you, but it didn't click forward.
Whoops.
There we go. Okay. Oh, so use this one to click forward.
Okay.
And if
Thank
you
you.
would like to be able to see it, you can take this like a rock star and walk over there. You wanna? Then you can be right there. You got it?
Yeah. So I examined the assessments available, and I investigated their efficacy with the law enforcement population specifically. So a lot of them, I'll outline that a little bit better in further slides, but a lot of them are made for different populations, psychiatric patients, patients undergoing surgery, et cetera, and then they're adapted to the law enforcement population, but many of them are not tested with the law enforcement population specifically or developed for the population specifically. There are some that are, I'll get into that, but
like I said, they're not originally made for them. I wanted a better understanding of hiring protocols altogether. So I started this, and then I wanted to bring attention to the shortcomings of the research on psychological testing and personality testing. I wanted to explore attributes that sort of came secondary because I was realizing that a lot of the areas that are tested for end up, they're like necessary attributes. And what I mean is, like, the literature says, like, oh, honesty, integrity, honor, etc. But some of them, not those three specifically, but some of them I was like, I don't know if those are necessary. Or maybe there's other ones that we're not thinking about that are necessary. So that's another area that I went into. And to bridge the gap between written and practice, I talked to people in the leadership field. So history. So before the 60s, there wasn't a lot going on. A lot of testing with law enforcement was based on cognitive ability. I don't really go into cognitive ability tests. That's like IQ testing. But after the 60s, the government said that professionals should be hired for psychological testing, and this is really when evaluations started being developed. In the 70s, development continued, and the first professional police psychologist was hired. In the 80s, there was a court case. I don't really know how to say that name, but Bonsignor versus the city of New York. It sort of just convinced chiefs in policing that if they didn't use a professional to hire their police officers, then their hiring decisions wouldn't hold up in court. And that's really, when it comes to litigation, that's what really drives people to make decisions. In the 90s, the Civil Rights Act and the ADA sort of changed hiring in a lot of ways. The Civil Rights Act, you can't discriminate, so you can't hire people based off of, or not based off of their gender identity and their race. And the American Disabilities Act made it so that for psychological testing, you have to offer a conditional hire before starting the psychological testing in case something comes up that would be considered a disability. And then you, in court, you can say, oh, I offered them a job, but it didn't end up working out. More examinations were developed and measures explored and updated depending on how old the research was. And reliability and validity, those are two things that I will explain better, but those are what really make the tests worthwhile and actually prove what they're supposed to prove. In today's times, well, the 2000s, more tests have been developed, and as of like early 2000s, police psychology became a proficiency, meaning that you can go to school for it if you really wanted to. So this is basically the process that I went through. My first semester as a senior, I started researching the assessments themselves and POST. POST stands for Peace Officer Standards and Training. It's basically a standardization tool. I have a whole slide on it that makes it so hiring protocols are guided. My second semester, I developed interview questions for the interviews that I held with senior leadership with my committee, and we obtained participants. So I got different names from people. I reached out to them about possibly talking to me about this, and it ended up going really well. And then based off of my research and the interviews, I constructed a recommendation going forward as to what I think needs to happen. So POST, like I said, Peace Officer Standards and Training. It outlines 10 basic investigation or background investigation dimensions. I'm not going to list 10, but I'll give you an idea. Like moral character, handling stress, work habits, interactions with others, and intellectually based abilities. Like I said, the goal is to reform and standardize hiring. It standardizes a bunch of things across the board. Another example is complaints. There's a whole way of dealing with police complaints now. It implemented certification expirations. So instead of you get certified for a police officer, you're a police officer forever. They now have to be recertified every 3 years. And that's basically done through an expedited hiring process all over again. You have to go through a couple more trainings. You have to go through another oral board interview. It's standardized what measures, like I said, oral interview. You need an attestation to moral character, so somebody needs to vouch on your behalf. Fitness, that's always been a part of it. And in Connecticut, polygraph is a part of it. In Massachusetts, it's not. It also, part of recertification is bias training. So you have to go to bias training every 3 years. But something that I recommend going forward, which I'll get more into, but there's no bias test that exists that is reliable and valid. There's ones that, I like to call them like BuzzFeed quizzes that will like show you your bias, but it's not reliable. These are the examinations that I went over in my research process. This is not all of them that exist. This is just what I had available and what I had time to read about. So there's 15. Out of them, 3 of them are made specifically for the law enforcement population. And that's the INWALD personality inventory, the MPulse, and the COPS R. 3 of them up here are based on the 5-factor model. So that's the 5 factors of personality. Those are openness, conscientiousness, extroversion, agreeableness, and neuroticism. 2 of them, when I was researching, ended up being recommended for promotion specifically. So a lot of that research starts with just hiring, and then they're like, well, maybe these areas would be better for promotion. And then the others, there's a few up there that there's not a lot of information on at all. That makes me think that they're not really used that often, but I can't really make a recommendation going forward on the ones that I can't read about. So for the attributes section, the literature that I read, like I said, it lists a lot of common sense traits for policing. So the ones that pretty much anyone would list if you asked them what you thought a police should exhibit in that role. So like that brought me to think like why certain ones are necessary. There's ones that are absolutely necessary. I'm not saying that they're not, but there are certain ones that aren't, and that made me question it. My example is assertion. So high levels of assertion are something that people test for in policing, but I think that assertion is something that can be taught or trained. I don't think that you have to go into policing having high levels of assertion. I don't think people are brought up in areas or in their life where you would grow up being very assertive. Some people aren't. Some people are very low on it. And I think that can be trained. So not that one trait will get you out of being a police officer, but that one trait contributes to your overall score. And maybe ones like assertion shouldn't be. This brings me to screening in versus screening out. Screening out is the model that is used for the majority of these tests. So it basically is a range of scores. And if you're within that range, then you're good. If you're outside of that range, lower or higher, then you're out. And that's screening out. Screening in is the idea that you are looking for, this is hard to explain, so if you have questions later, I'll try to better explain it. But screening in is when you are looking for a certain amount of traits, and instead of like a score necessarily, you're recognizing what they bring to the table. Warrior versus guardian, that's a police model. A lot of times these tests screen in for warrior attributes. Physical agility is a great example of that. But I believe that warrior attributes can be trained a lot of the time. Guardian ones, not necessarily. People come in with empathy. Empathy is very hard to train. And if you have to train somebody to be empathetic, I'm not sure they should be a police officer. So at the end of my research process, this is my analysis of everything. For the attributes, the screening out model limits who is hired to those fitting in a very specific box. So you're not getting as much of a variety as you could be. Some attributes are absolutely necessary and others can be trained. So I think that the ones that can be trained shouldn't necessarily be the ones that we're screening for. Should be screening for the guardian versus the warrior, which I explained. Post, it's an effective method of standardization. I think it's a great step in the right direction. But two downsides are that it doesn't specify which examinations should be used. That's up to the discretion of either the department or a third party that they contract out to do the hiring. And that could be a result of lacking research, what a certain doctor thinks over another, and there's no bias testing, just bias training every 3 years. For assessments, ones that are for the policing population are probably the best. I believe they are the best because the reliability and validity measures are based on that population specifically, not a different population and then generalized to police. Ones that are not made for police, more research needs to be done on these areas. What I found for research could be a result of what's available to me or what's out or what's not out there. But it was very difficult to find research that wasn't conflicting, or for some of them, like nothing exists, or one exists and there's nothing else contradicting it or corroborating it. Psychological/personality tests should be administered for promotion. And overall, just an expansion of research is necessary for us to decide which ones should be used for hiring. Did I go back? Oh, whoops. Sorry. The interviews, like I said, bridge the gap between written and practice. I learned a lot about the differences between Massachusetts hiring and Connecticut hiring. I learned about, at the end of the interviews that I conducted, I asked about what they thought necessary attributes were. And I prefaced that with saying, these are the ones that I hear all the time. Can you give me ones that aren't? And one that really struck out was cerebral, and cerebral just basically means you have like a critical thinking mindset. You're smart. So, I mean, that's a good one. I confirmed a lot of what I learned during the just reading process, and like my advisor said, there's an expansion of thinking both ways, so they opened up my eyes and I opened up theirs. My recommendation is that if examinations are to be used as they are now, they need to be used in a battery. And what I mean by battery is multiple at the same time, so that the strengths of one can make up for the weaknesses of another if they are to be used as they stand. Research needs to expand to cross-compare all assessments' utility with law enforcement. So I wasn't able to just look up the test and find a whole bunch of research in that area. Like, I had to change my search terms and look in different databases, and I think that because policing is in the climate that it is in right now, there should probably be a database verifying all of the hiring protocols that exist and how they work with police. Then, if that does exist, a battery can be formed to standardize which tests are used across all departments, and that would be POST. So POST doesn't standardize that. They just leave it up to the discretion of the department. Psych evals need to be used for promotional hiring. There's actually a settlement for like $64 million was just done because a test that they did use for promotional hiring was extremely biased. So that's what happens when it's not standardized. There needs to be a focus on screening in versus screening out, and a bias test must be developed. Like, training is great. I think that every 3 years is great. Honestly, I think it should probably happen even more because of how pervasive implicit bias is. But there's no test, so that needs to be done. I'm going to end my presentation. Not that you haven't been silent, but with a moment of silence for these people. I'm going to read their names. This is who I dedicate my presentation to: Daniel Prude, George Floyd, Breonna Taylor, Atiana Jefferson, Botham Jean, Philandro Castile, Alton Sterling, Freddie Gray, Eric Garner, Akai Gurley, Tamir Rice, Dante Wright, Michael Brown, Elijah McClain, Terrence Crutcher, Laquan McDonald, Betty Jones, Oscar Grant, Marvin Scott, Keenan Anderson, Tyree Nichols, Andre Hill, Manuel Ellis, Rayshard Brooks, Ora Rosser, Stephen Clark, Janisha Fonville, and Michelle Crusoe, and anyone else who has died at the hands of police brutality. Thank you.
Autumn, thank you for saying their names. At this point, we have time for questions for our presenter. What questions are out there?
Oh, sorry. Sorry.
Hi. Did any of the tests look at pedophilia? I know when I used to work with the police, one of our officers turned out to be a pedophile, and that was a huge problem. And I've read of other stories where it's not pedophilia. Well, yeah, teenage girls cops are powerful.
That's a great question, and now my mind's like racing. Not specifically, like antisocial behavior, a lot of them, and the oral board interview and attestation to good moral character, they focus on people's like interpersonal relationships, how they've performed in other jobs. I guess if somebody got picked for good moral character and they didn't think that somebody would be a good police officer, they could attest to that. But none of the tests that I looked at specifically focused on pedophilia, but that should definitely be something that they look for. I'm sure with what exists it may come out, but I can see how it could get hidden as well. Thank you.
Besides the lie detector, did you sense kind of trends or any, maybe more of feeling differences between the Massachusetts and the Connecticut departments with the testing, but even just beyond that?
Yeah, so Post makes it very similar. I used the polygraph as a main example because that's like one huge example that doesn't exist in Massachusetts versus Connecticut. I think Connecticut might be more progressive in the sense that they use more examinations than Massachusetts. That could also be like a funding thing. But another thing Connecticut is implementing is called CIT, and it's critical incident training. So their police officers, I'm speaking about one or two police departments, but I'm pretty sure it's getting more traction. But critical incident training is how police officers, they're training them to deal with people with mental health crises on a certain level, and then they're training them to use their discretion to decide whether they need to bring in a third party. So there's third parties, people who are trained in mental health crises to be brought in. So that's another big difference between Massachusetts and Connecticut. But a lot of the departments work together, as far as I know, and people talk. So I think that critical incident training is also gaining some progress in other areas. Thank you. Susanna?
I really like the concept of warrior versus guardian. So were there any, with all the different places that you interviewed, did you find one, I don't know, a
division that seem to be moving more towards that guardian kind of thing when they evaluate whether they're hiring?
I think that guardian is kind of like secondary, unfortunately, with a lot of places. But I think that's why I brought it up in my presentation, that a lot of them are, the assessments themselves are based off of warrior instead of guardian, or screening in versus screening out. And it's just like it's an administrative, like, deep founding thing where, like, it does come secondary, but a lot of them, especially with our conversations, they're like, oh yeah, like, now that you've said that, I am realizing that we do that, or we focus on the negative, which is screening out, focusing on the negative instead of the positive. And I don't think that they're, like, specifically aiming towards guardian as much as I would like them to. I think that we're moving in that direction, but a lot of them do focus primarily on warrior, because that's just how law enforcement has been founded. Thank you. Levi?
Did you find out why Massachusetts doesn't use the polygraph?
The polygraph was a while ago. It was like made non-mandatory for municipal hiring. It's mandatory for federal. I'm not sure about state, but that's why. And I think that it just costs a lot of money. So bringing in somebody to do that is a lot to commit to. Like I said, Connecticut uses the battery concept where you're using a bunch of things, and I think that they have allocated funds towards that area, but Massachusetts doesn't necessarily do that. So that's why. Anybody else? Lauren's mom.
I was trying to ask. So, through the research of the folks that you were talking to, and just in regard to police brutality, so there's obviously the hiring and the concern that they look at the background, but was there any discussion about looking at, somebody's, I guess, record? So if somebody has a history of some of this brutality type behavior, and making some changes from a job position, and taking them out of that environment before it becomes maybe a bigger issue.
Yeah, so I think, like, if it doesn't show up in the initial hiring process, I think that's why Post started the recertification process. I actually spoke to somebody who said that they make sure that this isn't across the board, but part of recertification for this department was retaking a psychological evaluation and a trauma measure of some sort, because as a police officer, you endure traumatic things, and that can change a person. So I think that that's how they do it, but if it's, like, too severe, then obviously you're not going to end up being recertified. And that's happened. Like 17 or 19 police officers since 2020 haven't been recertified for reasons having to do with that, or simply getting arrested. That'll get you uncertified, so yeah. Yeah.
Okay, let's give our
Thank
presenter
you.
another round of applause. All right. What a wonderful morning. That wraps up our first set of concurrent presentation sessions. Where we're going next, at 12:15, we're going to have our keynote speaker, Carly Thibodeau, class of 2020 honors program, over in the big room. So in the meantime, I do want to highlight that we have a student art exhibit in the lobby. She's going to be presenting this afternoon in this room, but you're free to kind of peruse her art at your own speed. So please do check that out, and I hope to see many of you at our keynote speech in just a couple minutes. Thanks, everyone.
I'm the only one who uses Canva, I will be honestly, I mean, sad, but also happy. Thank you.
You did a phenomenal job.
Thank you.
You did awesome. It's over, honey.
I know.
All done.
All done.
Yeah, I want one. Here,
He wants one with you.
Oh, okay, hold on 1 second. Let me just log out because this is like all my information.
I'm not used to being around celebrities so good.
You can ask for her autograph.
Cool. I can throw these away.
Take one with you.
That big room over there?
Yeah.
Levi made me present it to just him last night.
Oh, yeah, you did? It went well?
Yeah.
It was the mother, and it was Laurie, and like me. Perfect.
I didn't say as much.
No,
Good
only
job.
one.
You did such a good job. Good job.
I can tell
So
you,
proud.
I can tell you weren't that nervous because only they read it once. And it was when the thing wasn't working right.
Yeah.
Yeah.
So, it was awesome.
Thank you.
I know, were you nervous?
Yeah. I mean, pretty much. I thought I was presenting in that big room over there. Levi made me present in it last night. We got back. He lived upstairs, and we got back here last night. He's like, "Yeah, presenting in the room." And I was like, "Okay." So I literally stood there, and it was just him. Yeah.
Yeah, logged in the computer and everything.
Did you do the whole presentation?
Yeah, to me, last thing. Yeah.
How was it? Good? Video work?
Because Nate was pretty, well, they asked him what finance, so he put it in. This was the first time he did it. Do you use that one? You know, like, this one. And he comes to my house and I said, yeah, I have a hole in my site. And you have a hole in the poly of the yeah, oh my God, in the birds, and the birds, and a bull, and a mole, a fowl rather, eats this, and a mole eats, oh my God. What do you think? Oh, Dave, it was. But it affected the kids.
But it affected the kids.
Yep.
Tremendous.
Yep.
Finally got the message, right? But
I think they always knew they were afraid of her.
and the grandmother always had first.
Oh, yeah. Oh, yeah.
Oh, I could tell you stories and stories about her.
Oh, I can just imagine. Oh, I think they're together, but it's the weirdest thing because you never see them together, but they're still together. I think so. Two different times, right after another, and then Nate, Big Nate, told me that they're going to stay together until Cindy graduates. So coming right now.
I really don't care about that.
He kept, yeah, he comes from a lot of money. She handles it for what I was told that she writes all the checks out and gives her grandmother and grandfather. And I think,
Yeah, that'd be fine. Yeah, because I think I can still. Don't look yet. Yeah, I guess. Yeah, that's fine. Thank you very much. Maybe just a little bit. If not, that's okay. I can make do.
How far we go before we pull the cable out?
Right. Yeah, that's a lot better. Yeah, that's great. Thank you very much. Appreciate that.
Okay, this clicker does work. So you can click through without moving. And the video people have asked that you stay behind the podium so that people who are streaming it live online can hear you. Okay. So that's right. I moderate it. So I will introduce you, and then you introduce us. So I just want to make sure we have our presenters here. So Zaya is here. Good. Emily's going to start over there. All right. Welcome, everybody. Welcome back for some of you, and welcome for the first time for some of you. My name is Hillary Sackett-Taylor. I'm the Honors Program Chair, and I'll be moderating this afternoon session. This afternoon, we have 4 different presenters, and each of them has been given roughly 30 minutes, which will include both their presentation and time for Q&A. So I'm just going to ask the audience to hold your questions until the presenter is done speaking, and then we will have dedicated time for questions and answers at that point before we transition to the next speaker. So without further ado, our first speaker in the afternoon session today is Zaya Johnston, and she's going to be here and introduced by her primary advisor, Dr. Michael Filas.
Thanks. So I had not had Zaya for a student before we worked together. I was on sabbatical, and she came highly recommended by my colleagues. She wanted to work on horror fiction and Stephen King. So I hadn't read a ton of Stephen King, but I started. And we started talking over summer. And every book that I read, she had read it and she knew all about it. And we quickly came to the conclusion she wanted to write about it. And so I read all of it, all 1,000+ pages of it. And many people know that book because of the films of it. And Pennywise, the clown, the supernatural stuff, very memorable villain. But there's a lot more to it. So I'll let Zaya share with you her excellent research and conclusions, but I'm happy to say that working with her this academic year has been a real treat. She's so smart and capable, and our conversations about it were always really stimulating. I learned a whole lot alongside her. In fact, she learned much more about the book than would fit in her Commonwealth Honors Scholar project. And part of the difficult work of literary scholarship is figuring out what to set aside so you can keep a manageable scope. I know that many of Zaya's family and friends are here today, so I think you'll appreciate that I too discovered that Zaya has some stubbornness, and that served her well because she knew where to draw the lines in the sand about what she was willing to cut and what she wanted to keep in, and in the end, it worked out for the better. And she did a great job. On a side note, I also learned not to question Zaya about the scary stickers on the back of her laptop because some places you just don't go there. And also I just want to add, I was never easy on Zaya during this process. When I have a talented person and I'm working with them, I like to push them to see them do their very best work. And she was really great about responding. So I said she was stubborn, but also some of you will recognize that Zaya sometimes says, that's fair. And that's like a relief because that means that she's listening. I also want to take a minute to thank Dr. Brian Jennings, who was on Zaya's committee. He's also assistant provost, so very busy person, and he did that service, and he was such a careful and helpful reader. And Dr. Elizabeth Starr, who's my colleague in the English department, who was also on Zaya's committee. And the project Zaya's presenting would not be the same project without their careful input and work. So Zaya is also presenting this project next Friday at the Massachusetts undergrad conference that's at UMass. And she's done so well, and this is kind of above and beyond. She has submitted the article for this for consideration to the Journal of Stephen King Studies. So it's from where I'm sitting, she really accomplished a lot of great original research that adds to the discipline. So without further ado, Zaya.
Alrighty. Hi, everyone. Thank you for that introduction. It's very nice. Okay, so my project is called Dissociative Amnesia and Realistic Horror in Stephen King's It. Okay, so first things first, my thesis. I'm just going to read this aloud. So my project analyzes Stephen King's novel It through the lens of dissociative amnesia to see how the effects of realistic and fantastical horror come together to instill trauma upon the main protagonist. By analyzing their traumatic childhood experiences in Derry, I have illuminated the realistic horror in relation to the dissociative amnesia in this novel. So basically, I wanted to highlight something that not a lot of critics were talking about in regards to Stephen King or It, because Stephen King is such a big author and It is such a famous story. I really tried to talk about something that not a lot of people were kind of picking up on. Not picking up on or talking a lot about. And I found that, and I'll get into what the dissociative amnesia is and all of that, but I found that Pennywise was kind of overshadowing the whole novel and everything about it. And I picked up on this realistic horror, which I'll explain, and this amnesia just kind of being something that I noticed both times as I read the novel twice, and something that I kind of wanted to add to the conversation about and kind of emphasize a little bit more. So what sparked my research? Like Dr. Phyla said, I've always loved Stephen King. I've read a lot of his work, and it is my favorite novel. It's probably his longest at 1,100 pages, so it's not an easy read, but it's always been my favorite. And like I said, I just wanted to discuss something that not a lot of people are talking about, which is what you do when you write an academic paper. And I basically am just talking about how there's a lot of realistic horror going on in the novel, where there's a lot of parental abuse, racism, misogyny, and these kids are experiencing, that's going to keep happening, ignore that, sorry. These kids are experiencing just a lot of horrific things that are happening in their real and everyday lives that Pennywise is only emphasizing. I just kind of wanted to say that Pennywise is not the only horror going on here, and I feel like that's, in order to fully understand what's happening in the novel, I feel like that's really important. So just a very brief summary of it, because it wouldn't be fair to assume everyone has read the book or seen the movies. Basically, these are the both versions of Pennywise you'll see, depending on if you watch the 1990 version with Tim Curry or the current version with Bill Skarsgård as Pennywise. Sorry if you have a fear of clowns, but this is a clown project. You're in the wrong room if you don't like clowns. I should have said that at the beginning, but anyway. So basically, the novel is so long because it follows the trajectory of these kids as children and as adults. Pennywise is a supernatural clown who shapeshifts to morph into the kid's biggest fears, and he comes back every 27 years. And so so let me introduce the characters. So you've got Bill, Beverly, Ben, Mike, Eddie, Stanley, and Richie, and they nickname themselves the Losers Club. So if you hear me say the Losers Club, that's what I'm talking about. And it follows their lives as children, and then they move away from Derry after they defeat Pennywise the first time, and they're gone for about 27 years. And then what happens is Pennywise comes back, and Mike is the only member of the Losers Club who stayed. And so he calls the rest of the Losers Club back to say, hey, Pennywise is back, I need your help to kill him for good. And what happened was, when the rest of the losers moved away, they forgot everything that happened to them as children in Derry. So they forgot about Pennywise, but they also forgot about this parental abuse, this bullying, the racism, like both elements of the horror they completely forgot about. So he comes back every 27 years, and they only regain these memories when they travel back to Derry as adults, and they're only able to defeat Pennywise for good as adults. And I kind of come to the conclusion that they weren't able to put him like permanently to rest as kids, because Pennywise preys on their innocence and preys on their fears, and you can only really come to terms with that, kind of grow out of your childhood fears as adults. But I'll get into more into that later. So the dissociative amnesia in the context of It. Basically what I'm saying here is that the phone call that Mike gives to the rest of the losers, and this is a picture of them as kids in the newer version of the movie. Mike is the gentleman standing in the front with the tan t-shirt. When he calls them back, but this is as adults, right? This is the trigger that represents these memories to return, because dissociative amnesia is a real life amnesia that happens to people. And I'm not diagnosing the characters, I'm just heavily suggesting this really looks like what they exhibit in the novel. They would never regain memories of what happened to them as children if Mike did not call them back to Derry, because Derry is kind of this holding place of the evil and the trauma they experience as children. And without Mike saying, hey, you need to come back here, this is happening again, you know, they wouldn't ever kind of regain these memories. And they all come back to Derry except for Stanley, who is the kid in the red shirt in the back with the curly hair, because he actually ends up committing suicide when Mike calls him back, because the memories are just so horrific and he just can't handle the fact that he has to defeat Pennywise and kind of relive through the trauma again. So what is dissociative amnesia? Basically, it's a mental disorder that involves a disconnection and lack of continuity between thoughts, memories, surroundings, actions, and identity. And the second quote here kind of is really big in my project. It's a memory loss of not only certain time periods and events, it also is personal information and affects your relationships as well in real life. So I feel like Beverly, who was the only female in the Losers Club, is a really good example of this, because she was abused by her father as a child and she's later abused by her husband as an adult. And I feel like that repetition of abuse is kind of this amnesia kind of creeping its way in subconsciously, and I kind of analyzed Bill, Beverly, and Ben specifically in my papers, because going through all the losers, the paper would just be a book, not a paper. So I feel like you'll see as I kind of get into Bill, Beverly, and Ben, how this amnesia is kind of creeping its way in subconscious ways, even though they don't even know they have amnesia. They're so far gone from what happened to them as children that they're just kind of going through their lives. But there's a lot of things that are going on with them that are, once you, as an audience, you know this amnesia is going on, you can see how it kind of comes through. So this is a section where I'm going through Bill, Beverly, and Ben and exploring this amnesia and their realistic trauma that they went through. So this is Bill. So that's a picture of Bill as a child and then what he looks like as an adult, because in the movies and in the books, like I said, it kind of goes through their lives as 11-year-olds and then 27 years later. So I would say Bill is a really interesting character for a lot of different reasons. So you can kind of categorize him as a leader of the Losers Club. He's kind of always the one calling the shots and telling them what to do and how to fight Pennywise and kind of organizing people. But him and Ben also kind of have a crush on Beverly. There's kind of like a love triangle going on, which is also interesting. But I would say Bill is interesting because he kind of goes through the biggest trauma out of anyone in the group, because his little brother George is the first victim of Pennywise, and I think in 1957 when Pennywise comes back, Pennywise murders him and rips his arm off and eats him, you know. Very graphic, but it's necessary. And Bill has to go through this really horrific trauma that no other member of the Losers Club has to go through, because no one else loses a family member to Pennywise, but Bill does. And he kind of goes through an element of this parental abuse when that happens, because his parents start to neglect him because they miss his little brother so much. And there's this scene where his parents are watching TV and he comes in and is like trying to sit down and talk to them, but he can just feel like this void that Pennywise has caused. So I feel like that's a really great example of how Pennywise, this fantastical horror and this realistic horror kind of coming together. Like, this shape-shifting clown is causing real tangible trauma and like issues in their real lives. So not only does he lose his little brother, he also has a severe stutter that he gets extremely bullied for, because there's a resident bully, Henry Bowers, that targets all the kids, but he kind of targets some of the characters more than the others for differing reasons. But the stutter goes away actually when he moves out of Derry and only comes back as an adult when he comes back to Derry. So that's kind of another way that these traumatic events leave them but come back once they're in the place that they actually happen. So Lauren Christie is a critic I was looking at, and I kind of put her quote in Bill's section because I forgot to mention, Bill writes horror novels, and that's very important to this. Bill, when he's an adult, writes novels in the horror genre, which you would think he wouldn't because he went through such a traumatic childhood. This goes back to my point where this amnesia is kind of weaving its way through their adult lives, because you would think he would write like the most lighthearted things in the world considering what he went through as a kid, but because he doesn't remember, in the back of his mind, you know, he's writing these stories that are really, really horrific. And the book really goes into that, like, these stories are almost like pornographic in nature. They're so horrific because his childhood was like that. So Lauren Christie goes, we make up horror to help us cope with the real ones. The dream of horror is in itself an outletting. It may well be that the mass media dream of horror can sometimes become a nationwide analyst's couch. So that we make up horrors to help us cope with the real ones really spoke to me in Bill's section, because even though he doesn't know he's making up these fake horror stories to make a living on, like, he doesn't know that that inspiration is coming from deep within. It is. And I feel like that's just a really important point to highlight with Bill. So this is a picture of George, Bill's little brother that got killed by Pennywise. This first quote, both these quotes come from the actual novel, but this first quote kind of displays, in this scene, he's talking to his wife, Audra, when he's an adult. He had just gotten the phone call from Mike. And they're kind of going through, like, Bill is saying, I have to go back to Derry, I have some business to take care of. And Audra's like, now that I come to think of it, you never really talk about Derry or your childhood or anything that happened or anything like that. And so they kind of get into the topic of his little brother being dead, because he just remembered that his little brother got murdered by Pennywise. And Bill says to his wife, Audra, what I'm trying to tell you, Audra, is that I haven't even thought of George in 20 years or more. So you're kind of getting into this, when you're reading the book, you're kind of realizing, like, oh, they're forgetting, like, even things that you would think nobody could ever forget. But he is, and it's kind of emphasizes how severe this trauma is and how, like, you know, this amnesia has kind of taken over their adulthood. So the second quote is talking about when he's actively traveling back to Derry. It says, he can almost feel Derry rushing at him 18 miles a minute or not. The sensation is of being perfectly still while Derry rushes at him like some big carnivore, which has lain in wait for a long time and is finally broken from cover. And every character, when they get the phone call, has a similar feeling. They kind of feel like they're being engulfed. The character of Richie throws up right after Mike calls him. I mean, they're having these visceral reactions, because imagine you went through not only being terrorized by a clown, but your brother's dying, your father's beating you, you're experiencing racism, bullying. All of that is buried deep inside, and it comes back in a flash when you get this phone call. You know, you would have those reactions too. So Beverly is another example I wanted to look at. That's her as a child and an adult. So like I said, she was severely abused emotionally and physically by her father, and then later in life as with her husband. And her only outlet as a child and as an adult is really her friends. When she gets the phone call, which I'll get into in the next slide, from Mike, she actually has a physical, like a very severe physical fight with her husband. Because he's like, who are you on the phone with? Why are you talking to a man? And she's like, I have to go. And they get into this physical altercation, and they completely fight each other. And she ends up leaving, and there's this quote, which I'll read in the next slide, where she's like, getting that call from Mike was like the wake-up call I needed to escape from my situation. Which gets into this quote from Leonard G. Hildreth, a critic I looked at, where he goes, the past must be permanently escaped. Even the past self must be escaped if the future is to achieve realization and the individual is to create through experience a new self. So the only way that Beverly is really able to ever create a new self as an adult is to reunite with her friends and to kind of just force herself to go back through the trauma that her father and Pennywise put her through when she was a kid, because all of this is about healing trauma, right? And when they go back to Derry, they are forced to relive these experiences. And that's the only way they can really move on, and that plays into why they're only able to defeat Pennywise as adults. So on the left is Beverly's father, Al, and this is a quote from the book. And this quote takes place, basically her father, mind you, they're 11 as children in this novel. Her father is accusing Beverly of having sexual relations with her group of 11-year-old friends. And she's trying to tell him, no, we were just playing, it's not like that, but he's very possessive over her, and Beverly's a very sexualized character by her father and her husband. And Beverly's feeling, she goes, suddenly she understood that she was alone in the apartment with it, alone with it on this doozy August morning. It had been diluted somehow by her father's essential humanity, but it was here working through him. And I noticed a lot, and of course I expand on this in my paper, that Pennywise and Beverly's father are always talked about kind of at the same time, because Beverly, I guess you could say that the most evil and sinister force coming at these kids is Pennywise. But for Beverly, she has a special case where she's being severely abused by her father, right? So you've got these two sinister forces, and it is using Beverly's father as like a vessel to make her life even worse. And so every single time, you know, her father kind of has one of these episodes where he's chasing her around the apartment, trying to beat her, trying to rape her, do whatever, she can only equivocate that with like Pennywise, and she feels Pennywise as like evil energy coming through her father. It's like very creepy. So on the right is Beverly's husband, Tom Rogan. And this is the quote I was talking about. This is right after she gets the phone call, and she ends up beating up Tom and escaping. She thinks to herself, he'll live. This new Beverly, the Beverly who seemed to have surfaced at Mike Hanlon's phone call, replied coldly. Guys like him always live. You just get the hell out of here before he decides he wants to tango again. And mind you, Beverly was with her husband for years and years and never thought about leaving until she gets this phone call, because she thinks, oh my God, my friends who I haven't thought about in years and years, they saved me from my father when I was a kid. Maybe they can save me now. And those friends are kind of, so Beverly's kind of a different situation, because at first she feels like, oh, this phone call is my way out. But of course, when she gets back to Derry and they get haunted by Pennywise again, her attitude changes. So Ben, who was the last character that I deeply analyzed, he was severely overweight as a child. And that is the main reason for why he was bullied, because I mentioned all the characters were bullied, but he kind of gets the lot of it because he was overweight. Henry Bowers is the bully on the right here. And there actually is an incident where he kind of like corners Ben with a couple other bullies, and they carve the letter H into his stomach. It's very, very graphic. It's very sad, but it just goes to show you like the bullying here, the parental abuse. It's not just like go to your room. You know what I mean? Like it's like very severe, horrible, realistic things that are happening. And then his mother kind of contributes to his him being overweight, because she kind of guilt trips him into eating. So there's another element, that parental abuse. There's just a lot going on here that isn't Pennywise, that is making their lives really horrible. So these are some quotes here. So basically, after Ben gets the phone call, he goes to a bar to kind of drink off the news that he has to go fight Pennywise all over again. And he says to the bartender, he goes, Ben Hanscom looked at Ricky Lee. Ricky Lee's the bartender. Out of eyes that suddenly looked 10, no, 20 years older than the rest of his face. And Ricky Lee was astonished to observe that Mr. Hanscom's hair was graying. And mind you, they're like in their, like early 30s or something when they get this phone call back. So he had never noticed any gray in his hair before. Hanscom smiled. The smile was ghastly horrible. It was like watching a corpse smile. So this is another example of how severe their reactions are. I mean, like, it's so traumatic, all this coming back. He's like looking like he's aging like 20 years instantly, right? So then after this happens, Ben Hanscom says to the bartender, Ricky Lee, did you ever hear, Ricky Lee, of having an amnesia so complete you didn't even know you had amnesia? I remember Derry, but only because that was where he was calling from, meaning Mike. That's where Mike was calling from. So this kind of proves my point, you know, like not only is this news really horrible, they're like, I didn't even know that I was forgetting. You know, it's just so intense. And Aaron Mercer here says, certainly this novel is connected with childhood imagination, but is also concerned with the coming to light of the horrors of history that are both personal and communal, horrors that only adults begin to understand, which is the point I was making in the beginning where, you know, there's a reason why Pennywise only gets permanently put to sleep or killed, however you want to put it, when they're adults. Because not only do they have to cope with this trauma, relive the memories and move on, you know, children don't have those tools at that age, at 11 years old, to be able to really dissect and work through what happened to them. So as adults, they're able to do that. So just kind of highlighting my main thesis here and kind of doing some conclusions. You know, this project really is about looking at the realistic versus supernatural horror. And my main point here, well, there's a couple main points, but I guess the biggest one would be that without Pennywise, it is still a horror novel. I mean, if you cut out all the Pennywise parts, this book you'd be reading it and be like, oh, like, because I kind of highlighted some of the abuse, and the book is a lot more graphic than I'm making it in a lot of different ways. The amount of abuse and things they have to go through in their day-to-day life with the bullying, everything like that, it's horrible, and Pennywise only makes it worse. So I also kind of touched on this, and I kind of just put it in Ben's section in the paper, but I'm saying there's like this loss of innocence where they have to come back and they have to kind of grow up, because Pennywise preys on children and because they're very vulnerable and they have a lot of fears, and Pennywise can transform into a vampire or a werewolf because these are the things that kids kind of think, oh, you know, there's a werewolf under my bed or there's a boogeyman in my closet. You know, so he kind of uses that. But these kids are a special case because they have such horrible lives going on. They're like, not only am I going to turn to a vampire, I'm also going to, you know, kind of show up when your dad is beating you and chasing you around the apartment just to make it even worse. So Pennywise, and I'm not saying that Pennywise isn't important. Of course he is. You know, that's what people know this book for. But there's a whole nother layer of horror going on that I think often gets overlooked. So these are some statistics that I included in my conclusion because, like I was saying, there is a lot of abuse going on here. So this first one just talks about bullying. About 20% of students ages 12 to 8, which is about their age range, they're 11, but close enough. More specifically, being overweight, like Ben, is the most common reasons that children and adolescents are teased or bullied at school. And according to the CDC, at least 1 in 7 children have experienced child abuse or neglect in the past year in the United States. In 2020, 1,750 children died of abuse or neglect. None of the characters here die of abuse or neglect, but, you know, if Beverly didn't get out when she did with her dad or with her husband, who knows what would have happened. This, you know, and this issue of the bullying and everything like that, it just can't go unnoticed. And I think that Pennywise, because he's such a large figure, he kind of gets the spotlight. But like I said, there's a lot more going on here, right? So I guess my final slide here, my conclusions, is the idea of realistic horror or horrific experiences coming from people or places grounded in real life is a central part of what makes this novel so scary for characters and audiences. And this trauma is twofold, one part being steeped in fantasy, the other in realism. And both are to blame for the dissociative amnesia experienced by the main protagonist. So my point here is that this amnesia is trauma-induced, right? You're not just gonna get it because you stubbed your toe one day or had a bad day or got a bad grade on a test. You know what I mean? Like this is the kind of amnesia that comes from years of prolonged abuse, bullying, and getting haunted by a killer clown. All of those things come together to create a really, really traumatic and horrible childhood. And they're only 11, so they really cannot process these things until they're adults. And so I feel like when you read through it, because Pennywise is weaved into it so much and he has such a rich history with Derry and he's been there for so long, you know, there's a reason why these characters have such a horrible background and they don't all come from, you know, the idealistic household. It's just another way that these characters just kind of need to come together as adults and work through that trauma together and kind of resist against Pennywise and go, we're not kids anymore. You can't scare us. You can't turn into a werewolf and have us run away. We have the tools now to kind of, because they've regained those memories, they kind of use them to become stronger and stand up against Pennywise and defeat him for good. Thank you.
So we have a couple minutes, so maybe 1 or 2 questions from the audience for our presenter.
Yeah.
So Beverly's an interesting character because with her adulthood, there is a sort of idea of the trauma continuing.
Mm-hmm.
Do the other characters also have a sort of, as an adult, their childhood trauma is continuing?
That's a really good question. In the case of Eddie, who is a character I didn't highlight because I just wouldn't have the time, his mother is another example of parental abuse because she convinces him that he's sick and puts him on a bunch of medications and basically tells him, you know, don't roll in the grass, don't do this because you'll have to go to the hospital. And he actually ends up, the way King describes it, is later in life when he's an adult, he ends up marrying someone who looks exactly like his mother. Same facial features, same weight, same everything, and so you can kind of see in a lot of nuance, you know, little details. If you're not paying attention, you'll miss it. King does weave this amnesia with basically every character except for Mike because he stays in Derry and doesn't leave, so he's kind of like the only exception, but definitely there are other instances.
So I was leading to, what's interesting then is part of the power of adulthood is the adults are the only ones that have the power to break a cycle.
Mm-hmm.
And
yes.
So that's an interesting part of it.
Yeah, definitely, because, you know, this is, with the case of the Losers Club, these kids here, Pennywise, this is not the first group of kids he's killed. He comes back every 27 years. So as long as Derry has been a thing, Pennywise has been there. And it gets into the history of Pennywise in the novel and whatnot. But these group of kids who are now adults are the ones to break that cycle, like you said, because I think they utilize these regained memories so well, and instead of cowering away from them, you know, Mike says come back, and they do. You know what I mean? So I think that's very strong and very powerful, and them making that choice to be like, okay, we're going to break this cycle and not let other kids be killed, you know, is very important. So yeah.
I was gonna say, I feel like, you know, when they go back to confront Pennywise, it's kind of like the kind of therapy that you do when it reveals, it helps you think about these horrible things that happen in your childhood. I wonder, were the characters, any of the characters later in their life, were they getting therapy?
No, actually, which is interesting. And I think that a lot of that plays into the amnesia. If they had all those memories, I'm sure they would have sought some kind of help. You know, Stanley does end up taking his own life when he regains those memories. So that just goes to show you, you know, this isn't just your traditional, you know, my childhood was okay. I mean, like, it was really bad. So, you know, I wish they were able to kind of get that therapy and not have to go back and face that. But I guess it was for the better, because they did, you know, kill Pennywise, and I guess saved a lot of children coming up. So, yeah. Yeah.
My question is, why did you pick this genre to report on? I mean, out of all of the books you've read, why Stephen King? Why not something more lighthearted?
Yeah, I know.
I mean, you know, so why is he? Because he's your favorite author, or do you have other authors, but you were drawn to this particular genre?
I think when you're embarking on a project this large where you can literally do anything in the world that you want, I just love literature, so I knew I was going to pick a book. You know, I also love The Great Gatsby, but there's not much new things I can say about The Great Gatsby. So I thought, let me pick a book first that I love, an author that I love, and it has always been my favorite Stephen King story. I couldn't tell you why, but it just is. And I knew that I could say something that other people weren't talking about. I would have enough to talk about. And it really just came down to, what book do I love? I didn't want to pick a book where I felt like I would be trudging through the project and be like, great, I have to write another section. Every time I wrote another section, I was like, oh my gosh, and then I can write this. So it's just when in that kind of creative openness, I just wanted to pick something I knew I would enjoy. And since Stephen King has always been my favorite and I love this story, I was like, that's it. So even though it's not lighthearted, I like it. So, yeah.
All right, let's give her another round of applause. And is Professor Gardner here?
Yeah, he's on the hall.
Okay, yeah.
All of those stuff is laid out. One of them was out of order. I made sure they're all in order. So.
Where are you going to do the picture?
If you want to just come over here, you can do it.
Maybe I'll trade spaces.
Over there, yeah. In that general.
We can take down Hunter's poster too, maybe, and then that's a nice space for photos.
Yeah, I believe the green wall.
Yeah. Hunter, can we take down the poster?
It's fun. I have to do the like.
Oh, yeah. That's okay. No worries. No, we're taking photos and transitioning. Yeah.
The way I did it from the table was closest to like the podium.
Yeah. Perfect. You're the best. How do I hire you full time? Like, seriously. You want to be my like honors? I don't even know what we'd call you, but you're my honors program. No, it wouldn't even be interesting. Full-time position. So what I'm gonna do is.
Well, I said, I know you like to talk, so.
One
I
will
said
turn
one or
into
two. I
five.
said 5 means 7, so 2 is
Okay.
fine.
All right.
Perfect.
We have some time, and I noticed we're like standing room only, which is so exciting, but we do have more chairs. Could we maybe figure out a way to get some, is there room for more chairs? Could we pull out a couple more chairs so people can sit? We have some room up here in this front spot. We could put like a couple, 2 or 3 chairs here.
These are for Rowan's fam.
We can get some along the back wall, maybe. This is so exciting. I love the turnout. Great. There we go. It's a good problem to have. So many people. All right, well, welcome everybody. I see some new faces, so I'll reintroduce myself. My name is Hillary Sackett-Taylor. I'm the Honors Program Chair, and I'm moderating this session today. So we're on to our second presenter of the day, Emily Fluitt, and she'll be introduced by her primary advisor, Dr. Tom Gardner.
Okay, I'll take it off. Apparently it's all over, right? So I can see that. Hi, Tom Gardner. I'm chair of the communication department. So it was the best of times and the worst of times. The torch has been passed to a new generation. Ask not what your country can do for you, but what you can do for your country. These were the words we heard coming from our new young president when I was getting ready to graduate from high school. And when I went to the University of Virginia, I began to learn that the story that we had learned about our country being the shining city on the hill that was aimed at promoting peace and democracy around the world wasn't quite the story that we encountered when we got out into the real world. First of all, racism at the University of Virginia, which had managed to limit the enrollment of black students to 8 among 10,000. One of the reasons I first got involved in the movement there. I eventually dropped out of UVA and worked full-time in the civil rights movement and then later the movement against the war. What did we have? We didn't have the established press. I later worked for the established press, so I still have Reporter Notebook here. But we didn't have it then. The New York Times, the Washington Post, they were all repeating the official line from the government. It's often been said, oh, the press cost us the war. Professor Chris Appy at UMass has done a pretty good job of debunking that myth. Not until after the Tet Offensive of '68 was there any critique allowed into the mainstream media. So what did we have? We had songs. We had Phil Oakes and Tom Paxton and Joan Baez and Judy Collins, and we had art, and we had protest signs. We had film and filmmakers, and we had an alternative press. We had to have an alternative press because it was the only way to educate ourselves and others about what we saw as what was really going on. And the other thing we had was the First Amendment. Now this was important because certainly around the South, as I would travel around giving speeches, we were often involved in First Amendment fights with the administration to be able to speak. At that point, college administrators had gone through their academic career in the 1950s where you didn't allow dissent. And if you were one of those dissenters, you might risk your job even if you did have tenure, and certainly would risk a tenure track. So they didn't want dissent on their campuses. Their boards of trustees didn't want dissent. We got arrested. We had to fight in court. The ACLU was incredibly important. This is one of the reasons why ever since I've been at Westfield State, I've been teaching communication law, is to continue to promote the idea that the First Amendment and the freedom of the press and speech is critical to having a democracy that allows us to correct a course that was a wrong course, that allowed us to build an opinion in the public that led to the end of the Vietnam War. I want to just say that in context for why I was so excited when Emily Fluitt came to me and said, I want to do a study of the underground press in the 1960s and the anti-war movement. And so I want to recognize her and her work to study that legacy that we left behind, a lot of printed as well as digitized copies. And I want to give her as a present my favorite Westfield pen as the ultimate tool of liberation that still is more powerful than all those other swords and things.
Thank you guys so much for coming. I didn't know I had this many friends. Very big room. So first, I just want to extend a huge thank you, not only to Professor Gardner, but also to Professor Murata and Professor Morin, who I don't think could be here today, but you guys have been so helpful helping me do this project. You guys are all very knowledgeable in different parts of this project, and I think I couldn't have picked a better group of 3 people to help me do this. Also, huge thank you to the honors program. I've met some of my best friends from being in the honors program, and you guys have shaped my Westfield experience for the better totally. So like, what a better way to finish off my senior year than do my senior honors project. So how this project came about is my junior year, I took Professor Gardner's upper level honors seminar class on the Vietnam War, and we briefly talked about the underground press. And at that point I was thinking about what I wanted to do for my SHP, and it really combined 3 things that I really love, which is history, politics, and the media. So I was kind of able to nerd out for a year on this. So thank you to my parents and my friends for listening to me talk about the Vietnam War for a year, because that's maybe not everybody's favorite thing. But so just a little background on the Vietnam War. This was a very long war that the United States was involved in. It lasted from about 1955 to 75. There was no official declaration of war, which is really important to note. The United States went into Vietnam and was doing all of these horrible things without ever getting full approval and authorization from Congress to be doing this. Over 2 million civilians were killed in Vietnam, and many of them were Vietnamese civilians. And 58,000 American soldiers were either killed or missing in action. And then obviously something super important to talk about too with Vietnam is the draft. This was only the 6th time that the United States had ever had a draft for a war. Over 2 million men were drafted, and the draft became a huge focal point of a lot of the protests for the war. So what's the underground press? I didn't even know what it was before we talked about it in my class, but essentially what the underground press is, it's alternative media. So it was newspapers and magazines and publications that went against the kind of prevailing political opinion of that time. They were really unpopular for the government. The government did not like the stuff that they were posting in there because it disagreed with them. There was a lot of anti-establishment views, anti-war views, and they kind of were underground in a metaphorical sense. So they didn't have the same financial support as large newspapers like the New York Times or the Washington Post. They would do a lot of their work in coffee houses or universities, and they were underground, not in a literal sense, but in a more metaphorical way. There's a lot of government censorship on these papers. Even though they couldn't legally do a lot of the stuff that they wanted to, they would kind of work a way around to stop these people from publishing or punish people from reading it. That happened a lot, especially in the military, which I'll talk about a little bit later. A lot of their work focused on First Amendment rights, freedom of speech, freedom of the press, and there are a whole bunch of different subgenres of the underground press. So you had college papers, feminist papers, queer papers, black papers. For the purpose of this project, I'm going to be looking at civilian papers and GI papers, so papers that were written by soldiers. So for the civilian publications, the United States has a really long history of speaking out against the government. So people like abolitionists, Thomas Paine, Ben Franklin, they wrote letters and essays and pamphlets and spoke out against the government. So this was not a new thing. But in this era that I'm focusing on, the Village Voice, which is a cover of it is on the left, was kind of the first paper to publish in this new era of underground papers. So in October of 1955, they published their first paper, and they were part of a group of the original 5, is what a lot of the literature I looked at called it, which was the Village Voice, and then the Los Angeles Free Press, the East Village Other, which is also out of New York, the Paper out of East Lansing, Michigan, and then the Fifth Estate out of Detroit. A lot of the work was done by volunteers, so you can see a picture of someone on the right distributing the Berkeley Barb out of UC Berkeley.
a lot of it was, the papers were run on ad revenue, donations. A lot of people would do a subscription on like a pay what you can basis. And then another big tenet of a lot of these papers was something called participatory democracy, which was essentially a style of democracy that I'll talk about in a minute, created by someone named Tom Hayden, who's a well-known activist from that time, in something called the Port Huron Statement. Essentially, this involved collective decision-making, like the will of the people, and the idea that the people should be involved in the government decisions that are being made. And then the GI press. So this was a little different than the mainstream the civilian underground press. Started a little later, kind of the mid-60s, as the GI peace movement expanded. Once some things like the Tet Offensive, which is a huge turning point in the war, once those things occurred and soldiers started coming back, they started speaking out against the war. And a lot of their writing focused on firsthand accounts of the war. So all of the horrible things that they were seeing going into Vietnam, and then also the treatment that they received by military leadership. So they talked a lot about people that they call either lifers or brass, which essentially were officers and military leadership. And they talked about, being sent in military prisons, which is a picture on the right, and the conditions they were subject to as a part of speaking out against the war. The GI press also focused mainly on the war and the draft, whereas the civilian publications did talk about that, but they also talked about larger national issues like racism and class issues. So I did a pretty extensive literature review for this project, and I came up with 4 themes that I saw throughout a lot of the stuff that I looked at. So the first thing is that they had a very complicated relationship with the mainstream press. They really wanted to set themselves apart. A lot of the writers thought that the mainstream press had kind of like a fake sense of objectivity. The papers like the New York Times would always try to report both sides of what's going on. But sometimes bad things are happening, and as a journalist, you have the responsibility to call it out. You can't just say, each side has an equally valid opinion. They also did not show all perspectives. So these mainstream papers wrote from like a white upper class perspective, and a lot of the writers in the underground press did not fit that at all. So they really wanted to share other perspectives that they didn't think were being covered in these papers. Something else is the concept of truth versus fact. So a lot of these mainstream papers were publishing facts. They were saying, this many people were killed today in Vietnam, this many people were protesting, but they weren't really giving the truth. They weren't giving the context to explain why these things are happening, or that the people killed were Vietnamese civilians, or, maybe 100 soldiers were killed and 1,000 Vietnamese civilians were killed. The second theme from the literature review is that they like to use their papers as a tool for activism. So this involved a lot of publishing either, atrocities of the war, talking about stuff that was going on that they did not feel was right. And then a lot of these papers also were affiliated with an activist group or a union. So that paper on the right, Students for a Democratic Society, had their own paper called New Left Notes. And then The Bond, which is a paper I'll talk about later, was affiliated with the American Servicemen's Union. The third theme was democratic values. A lot of these papers focused on participatory democracy. So that middle picture is the Port Huron Statement, which is essentially a manifesto of the New Left in the 1960s and the type of democracy that they felt needed to be incorporated into the country, which involved equality, collective decision-making. And these papers not only advocated for that in their writing, but they also ran their papers that way. A lot of them didn't have like one editor-in-chief who would make all the decisions. They tried to do a collective project. They also focused a lot on First Amendment rights like freedom of speech and freedom of the press. This is also where a piece of criticism comes in for these papers. So while a lot of them did make sincere efforts to break boundaries of class and race, a lot of the literature talked about there was a noticeable lack of this in terms of gender. So a lot of the women that worked for these papers did experience a lot of sexism and misogyny. So although they did do a really good job for the time, they did have a long way to go. And then the last theme is the government response. So like I said, the government did not like these papers at all. They were just saying, bad things about them because they were calling them out. So the FBI and the CIA did a lot of surveillance and sabotage, especially on the civilian papers. The government response in the GI side was a little bit more small scale. It was a lot of punishing the soldiers for reading the papers or writing them. So then The actual deep dive research that I did, I want to thank, I don't think she's here, but my library liaison, Rebecca Brody, sent me this super awesome database with literally thousands of underground papers that have been scanned in since the 60s. So I looked at 3 civilian publications, which are New Left Notes, that one right there, The Rag out of Austin, Texas, and then The Great Speckled Bird out of Atlanta, Georgia, and then 3 GI papers, so Fun Travel Adventure, Bragg Briefs, and The Bond. I looked at 4 issues a year from 1968 to 71, and I chose that time because that was when the Tet Offensive happened, and that was when the anti-war movement really started to pick up in the United States. So I looked at a total of 88 issues, which was a lot of time sitting in Starbucks reading newspapers from the 60s. So what did I find? First of all, there's a huge difference between the civilian and the GI papers. The civilian papers, like I said, had a lot more influence. They talked about large national issues other than just the war. The GI papers mainly focused on the war and kind of small-scale issues that were occurring to them on their base. So for their relationship to the mainstream press, the civilian papers were a lot more critical of the mainstream press than the GI papers. I personally think that's because they had so many more competitors that were mainstream. The GI papers might have had like 1, maybe 2 official base papers to compete with, but these civilian papers had hundreds of thousands of mainstream papers that they needed to set themselves apart from. A lot of it involved calling out these mainstream papers for either wrongly reporting events or not reporting them at all. So the article on the left from The Great Speckled Bird essentially says that there was no press coverage of a protest that was going on where people were attacked. And then bad reporting, they felt, led to mistreatment of people on the bottom of the social hierarchy. Participatory democracy sought to end that mistreatment. So therefore, by doing good reporting, they were able to contribute to the participatory democracy that they set out to do. So using it for as a tool for activism, a lot of this was just raising awareness. So either good things or bad things is a very simple category that I like to break them into. So this article right here gives a phone number for draft counseling. So a lot of these papers were openly against the war and against the draft, and they would give people resources to get out of the draft or advertise for a protest or a meeting or something like that. And then these papers were also calling out lots of the violence and the abuse that was occurring in the war. And then a third thing, which I like to call a call to action. So a lot of these papers said, like, sign this petition, go to this event, do this specific thing to contribute to your anti-war activism. And then obviously a lot of it was just expressing views against the war, or in the case of the civilian papers, against police violence and racism and a whole bunch of other things that they were concerned about at that time. For the democratic values, there's a lot of focus on freedom of expression and the First Amendment. So the article on the right, from Bragg Briefs, says that the long arm of military law should not be allowed to reach beyond the military reservation to strangle freedom of the press. So they really felt that their mistreatment by their commanding officers for reading or writing these papers went against their First Amendment rights. A lot of writers also talked about how they felt that the draft was undemocratic. A lot of GI writers cited the 14th Amendment, which says there should be no involuntary servitude, and they felt that the draft was involuntary servitude. So that was a democratic principle that they included in a lot of their paper. And then the will of the people, that's a huge core tenet of democracy, and especially participatory democracy. So the article on the left from The Great Speckled Bird is essentially telling people that in order for the United States to be successful in this war, they need to follow the will of the people, which they really were not. And then lastly, what I found about the government response is GIs were punished for publishing, reading, or even like distributing these papers. So if they were caught on base reading an alternative newspaper, they were, given the worst jobs on base, like cleaning the toilets, or they were, this article on the left, that man was put in solitary confinement for a very long time just because he was against the war. The investigations that went on, it was a much larger scale for the civilian publications. They were investigated by large groups like the FBI, whereas soldiers were really just reprimanded on their base. And a lot of what the government did as well is they tried to interfere with the justice process. So if a soldier was caught reading an alternative paper, they technically weren't allowed to arrest them for doing that, but a lot of times they would make up charges or frame them. And then lastly, something that they did a lot that a lot of writers spoke out against is using the military against protesters. That often took in the form of riot control, which unfortunately is something that does happen today. The United States would use often the National Guard and send them out to these protests, and that was under the assumption that these soldiers didn't agree with the protesters or that they were against the war themselves. So, in conclusion, so obviously there are some limitations to this research. I only had a certain amount of time to do this project, so I looked at 6 publications. I would have loved to look at a whole bunch more. In the future, I think it would really be interesting to analyze the mainstream press in the same way that I analyzed the underground press. I looked for specific themes that I found in the literature, and I think it would be really interesting to see the stark difference of the reporting from that time. I think looking at Vietnamese papers would also be super cool. I obviously don't speak Vietnamese, so I did not look at Vietnamese papers, but I think looking at either mainstream or alternative paper to see the perspective from that time would also be very interesting. Lastly, I think art and photography would be a very important thing to look at. A lot of the papers that I looked at had drawings or photography or poetry in them. That's actually a picture that my grandpa John took when he was in Vietnam. I think he was kind of more quietly against the war, but I think that he would be really proud of this project, so I wanted to throw him in there. He unfortunately is not alive, but I think he would think that this project is pretty cool, so I am very just gonna put that picture in there. So why does this matter, right? Why did I spend a whole year doing this? The United States was so incredibly divided during the Vietnam War, and I would argue that it is at the very least as divided today as it was then. And it's so important for activists now to look back at what people did in the future and use things like the media and journalism to their advantage in order to be successful with what they want to do today.
Excellent. So we have time for a couple questions from the audience. Any questions for Emily? Adam?
So sort of going along with what we were just talking about, what do you think that the underground media would look like in like the modern setting, I guess?
It definitely does exist still. Some of the papers I looked at, still exists today. Like the Fifth Estate continued publishing through like 2016. I think social media has affected this a big way. I think even though it's like, I think there's a lot of underground reporting or like alternative media going on, and I think it's almost easier to do it now because you can share it with the entire world, versus having to, do word of mouth like they did then.
Any other questions? Dr. Raj. All right, let's give another round of applause for our speaker. So we're going to transition now. Our next speaker will begin at 2:30, so just a couple moments. I have an update for you, so maybe this coming week I can come and talk to you sometime. That's good.
They're gonna do it.
Oh, okay. Okay, over there? Or, okay. Let's do
I
it.
was hoping that would be the case.
Yeah,
Thank you for
so
the headline.
Excellent. What a cool project that she actually was able to find like the original papers,
Yeah, not all of them. I actually had a stack of papers I was missing. And we
Wow, what a cool project.
Thank you
And
so much
what
for all your
about,
work.
yeah, and
Good idea.
Thank you.
You have lots of good ideas.
Oh, thank you. Got our cheering. Okay, so Luann, this is the
I never have to do that again.
We'll give the full.
I didn't notice
I
it.
did?
Everyone in my family talks really fast. You should hear my sister.
No, it was fine though.
Especially when you're being introduced by a slow talker.
Seems like there's some transition happening in the hallways.
How long have you been sitting there waiting, just being like, I like look up.
¿Qué tal, guapísimo? Mira, me encanta el vestido. Thank you. That's design. Oh, she's fancy. She is. She could be made. And I sat in front so you don't get to. Well, I don't know if that'll help.
So I don't get to what?
You think you get nervous? You sat in front so you don't get nervous. You can just look at her shining face every time you get nervous. Yeah. She's gonna be smiling and nodding. Yes, the whole time.
Is it one from your because my mom said, this is not here, no? She said, hey, I'm
You're in my shot.
You get in love. That's what I was gonna say.
All right, are we ready? Okay. All right. Hello again, everybody. We are just about ready to move on to our third speaker of the afternoon. Rowan Ibrahim will be introduced by her primary advisor, Dr. Christina Bobian.
Thank you so much. My name is Cristina Bobian. I'm a professor in the Hispanic Studies Department. Hoy vamos a hacer toda la presentación en español. No, Rowan, you can translate your entire presentation in Spanish on the fly. We'll just do it in Spanish the entire time. Some of the facts I like to give in my elementary and intermediate Spanish language classes are that the U.S. is the second largest Spanish-speaking country in the world. There's no official language in the U.S., so although we assume that English is, and rightly so, is the most spoken language, Spanish is the second. Apart from that, right next door, Holyoke is the second largest population of Puerto Ricans off the island. It's a very large population. And then last but not least, I have a bunch more, but I won't bore you with more of them. Spanish will be the most spoken language in the U.S. by the year 2050. So a lot of people like to think that bilingualism is the way of the future, but bilingualism is the way of the present. It's everywhere. Spanish is everywhere. Languages are everywhere. And so when Rowan came to me to present this project, I was super excited to work with her, help her, guide her. She had already done an enormous amount of work on her own when she sat down to meet with me. And the fact that it is an interdepartmental, interdisciplinary project just makes it all the more exciting and all the more necessary and relevant for what we are experiencing today in Massachusetts, but also in the healthcare industry. So without further ado, I would like to present Rowan's project. Here you go.
Good afternoon, everybody. I'm overwhelmed by the amount of love and support in this room. And Christina, thank you so much for that lovely introduction. The past, I don't even know how many years, of your mentorship and guidance, and not just with this project, but since I began my double major journey here at Westfield State, has meant everything. And I feel like I am a much better person and more prepared for the world that is waiting for me in a couple weeks after I graduate. Also part of my committee is Dr. Susan Scott from nursing. She is unable to be here today, but she has been an absolute amazing part of this project. She kind of carries the nursing part of this. She is an expert on patient safety, and I look up to her a lot in terms of just, as a professor, as a nurse, and as a researcher. And then also Dr. Joan Cunley, who is also unable to be here today, but she has been with me from the beginning and just cheering me on. So I was really lucky to have such an amazing committee. So with this project, calling out the sacred cow, interpreting modalities and their effect on patient safety. So there's a few different terms here in the title that we're going to go over before we really get into the gist of the project. So background, personal experience. Why did I feel a pull to this topic specifically? So when it came time to pick a topic for my senior honors project, I knew that I wanted to pick something that was interdisciplinary and really speaks to the nature of my double major, being both nursing and Spanish. And being a nursing student in clinical, I saw a lot of nurses trying to care for patients that either don't speak English or don't speak a proficient amount of English in order to fully understand what's happening in terms of their healthcare. So just seeing nurses trying to, not really having a go-to in terms of an interpreting modality to implement in order to best serve patients was just really something that really caught my eye. And then also I am bilingual. I grew up being bilingual. I have family members who don't speak English, and they have required interpreting services. And then I've also been on the other side of it where I've kind of had to step into the role of the interpreter, even though I'm not licensed or anything. And we're going to talk a little bit about what that really means in the context of the healthcare setting. So that's just a little background as to why I picked this topic. This was a very interesting fact that I found in my research. In the US and Australia, 1 in 5 people speak a language other than English. Now, that's not to say that they don't speak English and another language, or maybe they only speak another language other than English, but it's just a very real statistic, and it really shows how big of a population these individuals make up, and just presents a very real reality to healthcare professionals in terms of, you will encounter patients that belong to this population. Healthcare systems depend on patients to make informed decisions. What really kind of catapults the healthcare process is a patient that is going to seek healthcare attention, medical attention, things like that. And that relationship really starts off with them revealing what's going on with them. And in order for them to be included, not just included, but to spearhead that process of getting healthcare, they have to be able to forefront everything that they're feeling, but then also make informed decisions. So they need to be aware of everything that's happening every step of the way. And we're going to talk about how interpreting really plays a big part of that. No best practice for interpreting identified. Nursing specifically, but really the healthcare industry, is driven off of evidence-based practice. There is a policy and a procedure for so many things in the hospital, which is what I've found throughout my clinical experiences here at Westfield. Whenever a healthcare professional is presented with a certain situation, there is a protocol, there is a series of steps that are outlined. First you do this, then this, then this. With interpreting, there is no best practice identified. There is no, in the event that you care for a non-English speaking patient, you go to a certified in-person interpreter, for example. That has not been identified. So nurses don't have a guideline to go off of when they are met with these situations. So what are they left to do? Just like figure it out on their own. And there is where a lot of error comes into play. Which kind of brings me into my next topic. What is a sacred cow? So that is the beginning of the title, calling out the sacred cow. So a sacred cow is an idiom that refers to a common practice found in a specific setting. So in this presentation, it's the healthcare setting, that is essentially immune to criticism and has become so normalized and so widely used that it's not questioned. With many things, if you go and ask a nurse, oh, why do you do this way? They will say, oh, because it's been proven that this is the most effective way, that this is the safest way for the patient. The same cannot be said for interpreting. So we're going to talk about ad hoc interpreting, and we're going to define that, and we're going to talk about how that is a sacred cow. So more to come on that. So goals: to establish a relationship between industry and academia. So with interpreting, and then this being an evidence-based project, we are inviting two different worlds that don't typically correlate into one project. So industry, with regards to the interpreting industry, it's a profession, it's a job. The focus of it is really focused on profit gain, and the industry standards are outlined by profit margins. And because interpreting services are often misperceived as expensive or difficult to obtain, other modalities have been put in place, reinforcing the sacred cow strategy, meaning because the focus is so on money, there is a lot of gray area in terms of kind of providing the best highlights. Academia, sorry. On the other hand, is the source of evidence-based practices. So that is where the evidence-based practices are determined and shared with others. Academia is also very centered on white individuals and English-centered voices, or English voices, excuse me. When we're talking about interpreting, we're talking about individuals who are either bilingual or multilingual, and then individuals who are non-English speaking or limited English proficient. Those are not voices that are highlighted in academia. So this is where we really get to see the big gap in research, which I'm going to talk about later on, because when I went to go do a lit review, I found a huge gap in research. I found very little research to go off of. So that really kind of highlighted the big distance between industry and academia. And then the goals are also to deduce which interpreting modality is the most effective in maintaining patient safety for the NES and LEP patients. So I'm going to define those two terms, but really because there is no best practice identified, this project really aims to do that itself, to identify what is the best, what is the safest modality to use for NES and LEP patients. Approach to research. So we have to consider a lot of things. So when I went to go approach these goals, I had to consider how to approach the research itself. With, the first step is to identify the terms, such as what the different interpreting modalities are, which we're going to talk about, and what patient safety is. When one goes to do their research, they model the approach to research, their methods, off of existing research. I did not find a lot of existing research, so I had to essentially create my own model in terms of data analysis and approach. Staying true to that first gen in me, just kind of going at it in my own way. And then how does that relationship change when an interpreter is involved? So here we can see the flow of communication with an interpreter. So when there is no interpreter involved, that standard relationship between a healthcare worker and a patient is one way, or two ways, excuse me. It goes like back and forth. So there is no really room for error if they're both sufficient in English.
or whatever language is predominantly spoken in that specific setting. Now, when an interpreter is involved, you're inviting a third person into that conversation. You're changing that dynamic, the flow of communication that is existing between the two, the patient and the healthcare worker. And there's a lot that needs to be considered because now you're relying on this other person to manage the flow of communication, to ensure that everything being said from one person is getting to the other and vice versa. So we really need to consider the structure on how the type of interpreting being used is going to affect that relationship. So definitions, so the terms NES and LEP. So a non-English speaking patient is an individual that does not speak English. So that one's pretty straightforward. Then we also have LEP, limited English proficient. So this is someone who is having insufficient capacity to understand, speak, read, and or write English well enough to effectively interact with health or other social services. Then the different interpreting modalities. There are 4 that this presentation really focuses on. Certified in-person interpreting is an on-site interpreting delivered by a professional that has been verified. So this is somebody who has undergone rigorous training and has undergone 2 different exams, an oral and a written component, and has been certified. So you know when this individual comes onto the site to interpret, you know that they are verified, certified, trained, and you know that really speaks to their capabilities to interpret. Video remote interpreting is interpreting delivered by a licensed interpreter via video call through a device such as a tablet. So this is essentially like FaceTime. Hospitals now have this tablet on wheels called a Stratus machine, and they bring it into the patient's room. They dial the interpreter in accordance to whatever the language the patient speaks, and they kind of FaceTime. So they'll just kind of stand on one side of the room, and they'll have a view of the patient and the other personnel, whether that's a nurse, a provider, a dietitian, a pharmacist, respiratory therapist, whatever, and they're going to interpret that way. Over-the-phone interpreting is delivered by a professional interpreter, but over the phone is essentially a 3-way conference call with the interpreter. So this one can get a little tricky because there is no visual component to this type of interpreting. The interpreter can't see the communication in order to really manage it well and the flow of it. So it's a 3-way phone call. You have a patient on the phone, and then you have a provider on another phone, and then you have an interpreter on another phone. It's really important to note that with VRI and OPI, video remote and over the phone, they are both professional interpreters, such as certified in-person interpreting. The only difference is that they are delivered remotely. Ad hoc interpreting is the big one. This is carried out by an individual who is not trained or certified, but is called on to interpret. So this is an individual who is bilingual or multilingual, such as myself, and they just happen to be at the right place at the right time. It's like I could be working on the floor, and then another nurse could have a patient who speaks Arabic, and then they can ask me, hey, do you mind coming in just to interpret real quick? I am not certified. I have not received formal education in Arabic, and I have not undergone any examination, so you don't know what my capabilities are. You don't know if I'm able enough to effectively provide interpreting services. So with ad hoc interpreting comes a lot of uncertainty. Patient safety. So this is the other focus of the project because we are assessing the interpreting modalities and their effectiveness of maintaining and promoting patient safety, because patient safety is a really, really big goal in the healthcare setting. Patient safety is defined as a healthcare discipline that emerged with the evolving complexity in healthcare systems and the resulting rise of patient harm in healthcare facilities, as it aims to prevent and reduce risks, errors, and harm that occur to patients during provision of healthcare. Long definition, but for the purposes of this presentation, I am dividing patient safety into 2 separate components: physical safety and emotional safety. They are both very big things to take into consideration when caring for a patient, specifically an NES or LEP patient. Now, what is the need for defining patient safety? It's the premise of this project. It is what the goal is that all healthcare practitioners share regardless of their role. And by dividing it into emotional and physical safety, we're more able to closely look at the different components that go into maintaining overall patient safety. So emotional safety, an experience in which one feels safe to express emotion, security, and confidence, to take risks and feel challenged and excited to try something new. This definition is not completely aligned with the healthcare setting, but we're going to adapt it for the purposes of this project. So a patient needs to feel emotionally safe in their relationship with their healthcare provider. Why? Because they need to feel that they trust the nurse or the doctor or whoever enough to disclose everything about their condition, to be very open and honest about everything. There are patients who come in and they feel a lot of shame with some things, and they choose, and they feel the need to hide it, and that can really affect their care. So if they feel like the communication isn't able to provide that sort of therapeutic relationship, then they're not going to be able to fully disclose everything happening, and that's going to affect their treatment plan because it's not going to be fit for their specific needs. And vice versa also, not only does the patient need to trust the provider, but the provider needs to trust the patient that everything is being shared with them so that they are able to develop an accurate care plan for them. And then also patients need to feel that they trust their provider enough, not just to share, but to adhere to any medication regimen, treatment plan, options, recommendations that the provider will recommend. Physical safety, the absence of harm, and in this context refers to an absence of harm to a patient. So physical safety is maintained in a lot of ways through, the checks of medication administration, so that you're giving the right medication, the right route, the right patient, the right time, the right dose. But then with interpreting, we're talking about, having an accurate and complete understanding of their condition. If something goes missed, they can be misdiagnosed. Different studies that I looked at actually shown that patients in the emergency department who were not able to be understood in terms of their concerns and their chief complaints affected the care plan. They were misdiagnosed, the wrong tests were ordered, things went missing. And then a care plan was developed, and it wasn't the care plan that that patient needed, and then they didn't get better. So just in terms of keeping them physically safe and being able to address the concerns that they have with their medical condition. So the NCIHC is the National Council on Interpreters and Healthcare. Like I mentioned earlier, there is a huge, huge gap in research. So when I went to go look at what the interpreting industry demands of interpreters, specifically healthcare interpreters, I found the National Council on Interpreters and Healthcare to be the biggest. Their standards of practice were published in 2005, and there has nothing more recently has been published. So this was kind of what I had to go off of. But I did kind of recognize that they were the ultimate say in terms of outlining what the standards of practice should be, because a lot of major healthcare systems locally, such as Bay State Health, actually cites the NCIHC in their job postings for medical interpreters. So they will say, in terms of job requirements, the interpreter must adhere to the standards of practice outlined by the National Council on Interpreters in Healthcare, and they outline the 9 standards of practice. So standards of practice were found to be the ultimate measure in patient safety. For an interpreter to be able to fully do their job, they need to adhere to all 9 standards of practice, and that is how I chose to kind of measure the effectiveness of each individual interpreting modality. So what I did was I juxtaposed each standard of practice individually to every interpreting modality. So I took accuracy, and I thought of it in the context of the certified in-person interpreter, then the VRI interpreter, and then the OPI interpreter, and then the ad hoc interpreter. So I really looked closely at every single standard of practice in accordance to each interpreting modality and kind of saw, did certified in-person interpreting uphold accuracy? Did ad hoc? Did VRI? And then so on. And I did that for every single standard of practice, except for cultural awareness, because that one is really hard you can't measure somebody's cultural awareness. So that was included in the discussion, but not so much the data analysis. So at present, the interpreting industry utilizes various standards of practice as a measurement of proficiency, as a measure of effectiveness. And each standard of practice either protects emotional safety, physical safety, or both. In this regard, we can conclude that when a professional interpreter is, when bound by these industry standards, which they are, so that would be certified in person, VRI, and OPI, when they implement these standards of practice into their own interpreting work, then they inherently protect patient safety. So what I did was, as I said, I took each standard of practice and I compared it to each interpreting modality. And then I used, to bolster the comparison, I used the evidence-based practices from peer-reviewed research that I found, which again wasn't much. So I had to take all of that. It was also all qualitative data. It was all experiences. One research study recorded 21 medical encounters between a doctor and a patient where they invited a nurse to come in and ad hoc interpret for these encounters. And then professional interpreters sat down and transcribed these interpreting encounters and found lots of errors in translation, in interpreting. So this was all qualitative data. It was all experiences. So in order to, like I mentioned, a previous goal was to deduce which interpreting modality is the safest, I had to turn that qualitative data into quantitative data. I needed numbers to look at to say this one is the best. So like I mentioned earlier, because there is no research, I didn't find any existing research to model my own research off of, so I created my own. So this is the scoring process that I used. So the NCIHC actually outlines, under each standard of practice, they outline policy markers. So who defines what is accuracy? I can't just look at certified in-person interpreting and say, that fulfilled accuracy 100%. So what I did was and I'll show you in the next slide here, I took each of the policy markers and I compared it to each standard of practice. So just to go back, sorry, I'm kind of jumping around. Full protection of patient safety was 40 points. So I took each standard of practice, certified in-person interpreting, for example, accomplished all 6 policy markers, meaning it fully accomplished accuracy as a standard of practice. So that scored 40 points, meaning it earned 100%, it met 100% of the policy markers, so it scored 40 points. Sufficient protection of patient safety was 30 points. So if they scored 60 to 79% of the policy markers, then they earned 30 points, and then so on. Some protection and then minimal protection. So then with looking with accuracy, the policy markers are: the interpreter renders all messages accurately and completely without adding, omitting, or substituting. The interpreter replicates the register, style, and tone of the speaker. The interpreter advises parties that everything said will be interpreted. The interpreter manages the flow of communication. The interpreter corrects errors in interpretation. And the interpreter maintains transparency. So in order to fully achieve accuracy, an interpreting modality has to achieve all 6 policy markers. So when I looked at, and I'm only choosing accuracy because, there are 9 standards of practice, but accuracy was the biggest, and it really showed a lot of variability between the certified and between the different interpreting modalities, because not all of them are able to really show accuracy. So I figured it was a really good standard of practice to share with all of you. Now we're going to look at accuracy in terms of the different interpreting modalities. So there were 6 policy markers outlined. Certified in-person interpreting met 6 out of 6 policy markers in all of them, so it earned 100%, so that translated to 40 points. Video remote interpreting, 5 out of 6 policy markers. It was knocked down on the policy marker of the interpreter manages the flow of communication. They are sitting on the other side of an iPad. They are not able to physically say, oh, okay, we're going to stop for a moment. I missed that part. Can we go back? Things like that, just to ensure that, everything else is being said. Over the phone interpreting was knocked down on, only earned, over the phone interpreting earned 3 out of 6 policy markers, and then ad hoc interpreting was only 2 out of 6 policy markers. They only got 2 of the policy markers correct. So therefore, the 3 other interpreting modalities weren't able to fully achieve accuracy. So here we can really see how certified in-person interpreting really starts to stand out in terms of being safer than the other modalities. Clicking on the wrong button. So results, just in terms of keeping this presentation a little bit more concise, I took a look at every single interpreting modality, which you can see on the top on the x-axis, and then I compared it to every single individual standard of practice, which you can see outlined on the y-axis, and then that is the amount of points that they all scored in total. So what can we see with this? Certified in-person interpreting clearly reigned supreme with a total of 280 points. It scored 100% in every single category. Their physical presence, the validity of their profession in terms of being certified and educated. There's just a lot with certified in-person interpreting that makes it shine. Video remote and over-the-phone interpreting, they also lacked a lot in research because they're newer modalities, so there wasn't much to go off of. So I really had to just kind of look at the nature of those interpreting modalities and then compared it to the different standards of practice. And then ad hoc interpreting scored a lot of zeros. So with that being said, ad hoc interpreting is the sacred cow. We see it a lot in practice. If you ask a nurse or anybody, why are you choosing another, a fellow staff member, a bilingual family member, why are we choosing them? There is no good answer, but it's like, there is no best practice identified for me to use otherwise, so I'm going to use what's available to me. So sacred cow, ad hoc interpreting being a sacred cow, it's not questioned, and it needs to be moving forward. And, you know, back to the discussion on industry versus academia and how the two need to connect more in terms of looking at this as a research topic. There's a part of industry that is driven by profit and a part of academia that is driven by white voices. And that kind of leads into the current gap in research because there's this disconnect between the two. And what this project aimed to do was, you know, fill in these holes. And in conclusion, certified in-person interpreting is the most safe modality, and ad hoc interpreting was identified as the least safe modality and a sacred cow. And then the gap in research caused by capitalistic industry standards and English-centered academia possibly perpetuates the sacred cow. Because there is that disconnect, the sacred cow can go on being implemented because it's not being questioned and it's not being identified as a sacred cow. Now, looking at you know, what comes next, what has this project inspired? It has inspired interest. It has inspired attention to something that is not being discussed, and the massive gap in research makes that very clear. And what can this project achieve both within industry and academia? Again, industry can take a look away from profit margins and the ability to save or make money, and it can look more towards the patient safety side to it. And academia needs to center marginalized voices more in order to better take a look at this. And there was a research article that Dr. Susan Scott actually shared with me, Disparities in Unilateral Do Not Resuscitate Orders during the COVID-19 pandemic. So this article looked at UDNRs. So a DNR is a Do Not Resuscitate Order. Is something that patients opt for if it says, it's a legal document that says, I do not want life-sustaining measures in the event of a cardiac arrest. A unilateral DNR, a UDNR, is just issued. A doctor can say they get a UDNR. So in the event of cardiac arrest, they are not to receive any life-sustaining measures. This study found that the Spanish-speaking population unproportionately received a massive amount of these UDNRs in comparison to their white patient counterparts. There was a question of, is it because Spanish-speaking patients were more likely to get COVID? It found out no. It was just because of these communication barriers. So by providing interpreting services, it kind of hinted that interpreting services would have been a better way in terms of avoiding all these Spanish-speaking patients being issued UDNRs that were issued inappropriately. NES and LEP patients are being ignored both within research and academia, and inherently ignored by academia because I did not find any research on it, and again, because there is no best practice identified. So just even bringing that to light, this project can really kind of forefront more research on this topic. And my references, and then this is a QR code to the SHP paper for anybody looking to read more about it.
Wow, it sounds like we really need to get this published. Yes. Wow, we're working on it. Excellent. We have time for maybe one question from the audience. Is there a question out there?
When patients come in and, when you come into the ER, you have to fill out a form. Is there like a special place that has like languages preference or interpretation? Is that being ignored, or is it just an emergency? They come in, they speak a different language, and it's not the first thing that comes to mind. Let's get someone certified. Let's just get a staff member.
Yeah, so in the ER, it also depends on like how they arrive to the ER. So if they're arriving in an ambulance, nobody's gonna really stop to ask if they're unresponsive, what language does this person speak? But in a typical admission process, when a patient does get admitted to the hospital, throughout the admission intake forms, they do ask about language spoken, language preferred, and then any like cultural or religious considerations that they want to be taken into account when planning their care. Is that looked at? Not really enough. In report, when we do handoff, so when like the day shift nurse leaves and the night shift comes on, they will communicate, the patient speaks English or the patient speaks Spanish, but mom is at the bedside, she speaks English, things like that. But in terms of language, it is kind of known what language this patient speaks, but what types of interpreting services are provided, whatever is more convenient for that time. Yeah.
All right, I think we could all ask a million questions on this, but we've got to move on. So let's thank our presenter one more time. All right, so we're going to quickly transition to the next speaker. Give us a few minutes. We're running a little bit behind, but we're just going to be a go with the flow kind of crowd today. So give us a few minutes for the next speaker. Okay, we definitely want to get some photos. I don't know where Gwen is. I will find her. She has, oh, there she is. Can we get a photo?
Sigma Delta.
Should I come in this
It was partly because we wanted like a downtown setting, proximity.
That's what they came from Northampton.
The main drag there versus here. So anyway, I have someone else that did have some verification. Did it bring back memories?
Yeah, definitely. Like running up to campus alone, it was like.
Have you
I had a few friends, but they had long since graduated, so.
It's, I've been feeling very nostalgic today, and so at lunch when Carly had this selection, like, you know, we were all with first day something.
And then I recognized people in some of the slides, and I was like, wow. Because she graduated a year after.
When you're younger.
Yeah, that's right.
It's always When I think about when we your family's college years overlapped with more. So Gabby was called back. So you were fall of that team was already asked. And anyway. So,
It wouldn't be an academic conference if we were not having some tech issues. So welcome to academia. I'm also, just while I'm stalling, going to tell you all that you are in for a very special treat by coming to this presentation, because this is going to be a moving presentation. So moving in both like the emotional sense, but also the physical sense, in that Janky is going to give a presentation here in front of the screen, but the bulk of her work has been her actual physical art, which some of you may have seen as you come in. But in case you didn't, what we decided is that we're actually going to have her give her presentation, and then I'm going to invite you all to migrate with me to the lobby for the Q&A portion, so we can actually be looking at her art live and in person as you're engaging with the artist. Okay, so we'll do a little bit of presentation here, and then we'll all move out into the lobby to be a part of the art. Do you need me to do this two-step verification, man? I know. But like, protect your identities, people. Protect your identities.
Yes, the software engineer affirms.
Yeah.
Well, because Rodney's tall. Small but mighty.
So important. I'm so hoping that that gets published. That would be really good. Proof that game was there. Proof that game was there. You just had it. They might not know. And even having a I know. That's like shorter, right? Do you know this? Or like, are you using this? And then put those in the signatures. Because then you could go to wait. Thank you for your patience, everyone. We're getting the technology figured out. I know. This gentleman's helping her, but.
Today is 47 minutes and 12 seconds. Because you've been with them all year, haven't you? So you were in the Symposium in the fall, right? Do you know yet what's happening next? And I think we're having lots of thoughts. I mean, thinking about like, should it be in
I know. Is this thing on? Okay, it's not on.
So this mic is for the stream.
Oh.
Chris, could you help us get this laptop connected?
Is this thing on? Okay. It's on. Hi.
Yeah, because you've just got USB-C connections, right? So the clicker's not going to work.
Yeah.
Someone's going to have to be
So,
here to, or we
You
can.
can just walk over and press it.
Physically move this. Sure.
To have it. Oh.
Is it that it's too stretchy? We're almost there.
You just have to stand up there, Chris. Let's try this again. Bizarre.
Revenge trips. We don't think the universe was
Where's the... I don't see a cursor. Oh, there it is.
Success.
All right. Thank you for your patience, everyone. It's going to be well worth it. I'm telling you. You're going to be blown away, and we're going to invite you after this portion of the presentation to join us out in the lobby for Q&A with Janky so that you can see her art live in person. So without further ado, our next speaker is Jankelishka Burgos Cruz, and introducing her is her primary advisor, Jamie Wainwright, and her second reader, Dr. Wilma Ortiz. I'll hand it over to Dr. Wainwright first.
Hi, everybody. Good afternoon to family and to everyone. It's my pleasure to introduce Janky today for our honors project presentation. We will learn about Janky's life and the evolution of her path of creating art and becoming an artist. As an artist and the chair of the committee, I was able to see the insights of her growth from the formation of Janky's work of art, reflecting and asking myself about my own journey about how to make art myself. I value this experience of watching Janky develop and grow throughout this process as an artist and an illustrator. Getting choked up. I'm going to share with you one of my last questions that I asked Janky. I asked, what was the moment in time that you knew that you were an artist and you wanted to create art? Janky grinned with a big smile and replied, when I started 7th grade, I attended school that focused on art and cinematography in Puerto Rico. At this school, I could study art and learn how to hear my own visual voice and my personal works of art. I was given a very long list of art supplies that were very expensive. My mom took me to buy my first watercolor set. It was $7. It was called Praying Half Pan. This was a lot of money to spend, but my mom bought the set for me anyways. I vividly remember that day and how excited I was to start school. She said the memory will never leave her heart. Janky went on to say that she cherishes this watercolor set and still paints with it today. Janky, I'm so proud of you and how hard you have worked for this goal, for your commitment to your own accomplishments and what you're going to share with us today and your promising future. Thank you, Janky, for letting me work with you.
Hola, you notice how technology failed. So I know how my memory failed, so I have everything written down. With your respect, I'm going to read what I wrote. Buenas tardes a todos. Good afternoon, everyone. It has been a privilege to witness the process, evolution, and creation of each of the artworks Janky created for her Seniors Honors Project. Each of these masterpieces invites the viewer to activate their senses and travel to the Caribbean and visit the island of Puerto Rico, to imagine and flavor some aspects of the Puerto Rican culture the way Janky sees it, feels it, and lives it. Janky's experience and memories of Puerto Rican culture get confirmed and enriched by the stories collected through the interviews conducted for this project. This project is a window to certain elements of the Puerto Rican culture, which could be familiar to some, while unfamiliar to many. Today, each of you, the audience, are the lucky ones that get to see the fruit of Janky's labor of love and passion. I hope you appreciate the thinking behind each piece and the techniques used by these gifted artists. Yankee's resilience, determination, and commitment helped overcome many obstacles and make the dream of having this art exhibit a reality. To end, I would like to name the many roles I played in Yankee's life. Mom, with your respect. First, I am the co-advisor of Latino Association for Empowerment. It's a student organization in which Yankee has been the president ever since I invited her in 2021 to help me revive the club that was dormant during the pandemic. I have also been a mentor, a friend, and a Puerto Rican second mom, the honors project leader, and finally, one of her interviewees. At this moment, I would like to express my deepest gratitude to Yankee for including me in this project, for providing the opportunity to remember some aspect of my own childhood in Puerto Rico, and for the chance to laugh, to rejoice, and relive parts of my life when I was telling my story. Unintentionally, however, Yankee's project allowed me to feel the loss and the sorrow for the people, the places, and the years of experiences I left behind. Yankee, your journey is my journey. And your vision for this project has exalted the beauty and the greatness of the land, the people, the language, and the tradition and culture of our Puerto Rico. Eternamente, Yankee, agradecida, te amo mucho.
Hi, everyone. Well, I don't know how I'm going to read those introductions, but my name is Jankelishka Burgos Cruz. The title of my presentation is Fine Art and Etherealizing Puerto Rico. First off, I'd like to begin by defining some of these key terms. So what is fine art? Fine art commonly refers to a form of art that is aesthetically pleasing and that takes a certain set of skills to achieve. It's also commonly called art for art's sake, which essentially just means that it doesn't need a monetary or commercial reason to exist. It simply just exists because the creator wanted to put it out into the world. And the other big important definition is ethereal, which is not a word that you see in everyday use. So ethereal means extremely delicate and light in a way that seems too perfect for this world, so otherworldly almost. And this I'm going to circle back to later in closer to the end of the presentation. So I want you to just keep this definition in mind and think about what that might look like for you. So Puerto Rican culture is a culture that is permeated with struggle. A lot of people say that politics and protests are actually Puerto Rico's national sport. Puerto Rico has suffered a lot under the hands of Spain and the United States. Once we were about to be granted independence from Spain, the U.S. came in and invaded and took over during the Spanish-American War. They imposed a U.S. chosen leader and didn't let Puerto Ricans elect their own governor until halfway through the 1900s. Probably the closest thing that brings our people together is the idea of suffering, whether that be the near genocide of our indigenous ancestors, the ban and subsequent change of the colors of our flag, the forced sterilization of our women in the 70s, the use of our smaller islands for bombing practice in World War II, the poverty in our streets, and the corruption in our government. Puerto Rican people have been tethered together by how difficult it is to be Puerto Rican. And besides the name, the Island of Enchantment, which you might be familiar with if you've ever thought of visiting Puerto Rico, our island has another name. And so I'd like to welcome you to the oldest colony in the world. So, much of our struggle bleeds into most of our forms of expression, and this very much includes fine art. So much of the work that you're going to find if you go to a museum in Puerto Rico is going to focus on colonization, protests, the dangers of industrialization, poverty, misogyny, among many other things. And this is a common theme among a lot of marginalized identities, not just Puerto Rican people. And that's because shared trauma and struggle kind of permeates conversations about culture, so that eventually what it becomes to be Puerto Rican is to struggle. Being Puerto Rican is to be poor. Being Puerto Rican is to be taken advantage of, to be a victim of US imperialism. And one of the questions that I wanted to talk about this project is, what about the rest? What about perseverance? What about pride? And what about joy? Puerto Rican identity is a beautiful mosaic of food, music, dance, patriotism, and a blazing passion for the little things in life. And this is, here we get into what this project aims to do. And that is, when it comes to Puerto Rico and fine art, there's a few things that tend to be lacking when you walk into a museum. And that is going to be joy. You don't find a lot of artworks that focus on joy. And you also don't find a lot of artworks that focus on probably the most joyful time in one's life, and that's going to be childhood. So here we get to common childhood experiences. My family's enjoying this right now. So when we come to the topic of common childhood experiences, it became very important very quickly to this project, because in the culture of the island is very tightly knit. And so there's a lot of overlap in childhood experiences. It's almost like the island has like a collective consciousness between peoples. So in my own generation, pretty much everybody had certain similar experiences. Like everybody had what we call the limber lady, and that's the lady you go to buy limber, and she's in every neighborhood. Everybody's got one, and you can get the one for $1 or the one for $0.25. Everybody has the little store in front of their school where you can buy candy and snacks during lunchtime. Everybody bought sticker packs for their sticker books. There's just certain things that everybody is familiar with and everybody knows about. And so I kind of wanted to collect these experiences and devise 2 parts for this project. And that was going to be the interviews and the art pieces. So when we get to the interviews, these were done in English, Spanish, and bilingually. The idea was to get people's most authentic responses. And so we wanted people to be able to answer in a way which was most comfortable to them, so that we could get those really, like, the best responses possible. So the interview questions, and I'm just going to list them out, were: which town did you grow up in? How many years did you live on the island or have been living on the island? What is your favorite native fruit and why? What made you the happiest in your childhood? What is a sight from the island that you'll never be able to forget? When you were young, what was something that had always excited you and the kids in your neighborhood? Can you tell me a story about something from your childhood that has had a strong positive emotional impact on you? When I say Puerto Rican, what is the first thing that comes to mind? What do you love the most about Puerto Rico? Using these answers as well as my own personal experiences, I compiled ideas, images, symbols that were supposed to make their way into these pieces. And with that, I could start the series of paintings. So I collected a pool of inspirations, artists which I kind of looked to, either whether that be for the way they use color, technique, form, materials. And here are just some examples of some of my favorite artists: Heikala, Koyomori, Alphonse Mucha, Ria Briego. And some of these I have art books displayed on the table if you guys would like to look at them. And their art is absolutely fantastic, and they're what inspires me. But probably the biggest inspiration is actually the work of child author Jane Brett and her use of thematic borders in her storybook pieces, which is something that I aimed pretty much directly to replicate in my own series of painting. I wanted thematic borders because the subject material for each of these pieces was going to be so varied. I wanted something that was going to visually tie them all together. And so I decided to use that by using borders. So we're going to go ahead into the creation of the first piece, probably the most important piece in this entire series. And that starts with the concept. So the direct concept for this piece was about the flamboyant tree, which is the national tree of Puerto Rico. I wanted to anthropomorphize it. If you don't know what that means, it basically means to like turn it into like human-like, like personify it. I wanted to anthropomorphize it into a giant woman holding and playing with school children. And the red color of the flamboyant tree was supposed to be the focus of the piece. The idea was derived from memories of my childhood regarding the flamboyant tree, which I'm going to share more about in the statement for the piece at the end. So all these pieces typically start with quick thumbnail sketches. As you can see right here, I'm experimenting with posing. So I was experimenting with how much of the figure I'm going to choose, what the figure is going to look like roughly, how much space is she going to take up in the image. And these are all done relatively quickly, about 30 seconds to a minute. Just kind of quick experimenting, not focusing too much on the details. And over here, you can see I'm kind of thinking about orientation, and you can see kind of the rough idea of where the border started coming in. So ultimately, I chose a horizontal orientation because I wanted the showcase of the piece to be the hair of the giant tree woman, because that was going to be the flamboyant flowers. And I also decided that I really wanted to zoom into the head. So then we started working on the borders. So I used this program called Procreate on my tablet, and I kind of just traced a bunch of flowers to use as placeholders so I could more comfortably move them around and work it into a composition. If you look at the difference between the first picture and the second picture, after speaking with my committee, we discussed about how much space the border was taking up, and so we decided to kind of de-emphasize it. So you can see in the second one, there are more things in the border, but it's much smaller, it takes up less of the image. And ultimately, I just wanted I didn't want attention to be drawn away from the piece, and that was very important to me. And here you can see the complete physical line work for the piece. If you notice, the lines are blue and red, so this is done intentionally. I use pencils that are blue and red so that when I paint, the lines kind of fade away into the color of the piece, and it basically looks like I didn't draw anything, it just kind of appeared magically. And this is gonna be my favorite part, so you can't blink during this part, but this is the final painted piece. So this is the end result. It runs about 19 inches by 15.5 inches, and I use colored lead pencils, watercolors, wash, colored pencils, white gel pen, and probably a couple other things that I'm not remembering. And it's here that I want to circle back to that word ethereal. Extremely delicate and light in a way that seems too perfect for this world. When I picture these niche aspects of my culture, they are otherworldly beautiful in my own mind, in a way that is impossible for me to be able to convey to you all with words. And so my goal with creating these pieces was to be able to place the audience in my shoes and allow them to see through my eyes and kind of give them a picture into my own mind about what, to me and to the people that I interviewed, what Puerto Rican culture feels like and looks like to us. Because to many of us, Puerto Rican culture is something that is already too perfect for this world. So my goal was to garner the ability for all of you to be able to see what I see. And these are just a couple details that I wanted to focus on in the piece. So if you see in the corners of the border, this is Puerto Rican anole. In the countryside, we call them gallina de palo, which translates directly to tree chicken. And technically, it's a term that you're supposed to use for iguanas, but we usually use them for every kind of lizard because that's how it is in the countryside. This is another one. I wanted to give the piece a bit of a distinct touch. And so I decided to give her an earring. So this is a tire earring, if you've ever had a tire swing on a tree. Another thing that I wanted to do was, the title of the piece is Phoenix Tree, and I'll be going into that in the statement. But for the phoenix, I wanted it to look distinctly Caribbean, and so I chose a white-tailed tropic bird, which is a tree that kind of goes around Puerto Rico, and you can see it there frequently. And then finally, probably my favorite detail is the flowers of the flamboyant, which is what gives it that distinct red color. And there's not much to say about it. I just think they're beautiful, and I want you to look at them. And then, again, I'm just going to show you all again so you can look at it. And I'd like to finish off with the full written statement for this piece. Oh, actually, there's one more thing that I'd like to mention, and that is the fact that in the preliminary sketches, you might have noticed that the figure had a bit more loose hair. And that was something that I had talked about with my committee, the choice to make the tree resemble almost an afro. And that was an important part for me because I wanted to be able to portray all kinds of Puerto Rican people in this project. And I think, especially when it comes to women, I feel like Afro-Latina women are rarely given the opportunity to be seen as beautiful. And I think not only are they women, but they are Black women. And not only do they have to face oppression for being Puerto Rican, but they also have to face oppression for texturism, colorism, and all these other things. And I wanted to showcase pretty much the centerpiece of this project, and probably the best representation of what beauty looks like in this island as somebody who was Afro-Latino. Okay, now I'd like to finish off with the full written statement for this piece. The flamboyant, sometimes referred to as the fire or flame tree because of its iconic red flowers, is the national tree of Puerto Rico. To me, the flamboyant tree is a unique symbol of home, as when I lived in Puerto Rico, there was a big flamboyant tree at the top of the hill that I lived at the bottom of. I could always see it clearly from the porch, and when I walked back home from school, I'd jump and tear some of the leaves off of the center stem because I liked the way that it felt on my fingers. I always felt as if it was greeting me, welcoming back home. I named this piece the Phoenix Tree because it burns brightly, sheds its leaf like a phoenix turning to ash, and then blossoms again, scattering its red flowers everywhere, like a phoenix rising from the ashes. When I moved to the United States, it was one of the first things I lamented. Even now, in times of struggle, I think about the flamboyant, a tree so loud and proud and an unapologetic symbol of Puerto Rican pride. I wish to someday be that unapologetic. And for a moment, I would just like to thank my wonderful, beautiful, amazing committee members, Professor Jamie Wainwright, Professor Flores Wima Ortiz, Professor Rob Kimmel, who sadly couldn't be here today, and Professor Hilary Sackett-Taylor. And then, obviously, special thanks to the audience for all of you listening. Thank you for coming. Thanks to my entire family for showing up. Thank you to Professor Diana, who was the person who even gave me the idea of doing a project based around art. I didn't even know you could do a senior honors project not based on your major, and without her, I truly would not have even thought of doing something like this. And special thanks to Professor Catherine Savini, who also couldn't be here, but she is the entire reason I can even do the senior honors project because without her peer pressure, I would have not applied to be in the honors department. So thanks for her, and I'm sure she'll see this in the recording.
Okay, so I would actually love to invite everyone here to move out into the lobby where you can see these pieces of art, not just the one that Jenkins spoke about, but also others in this series, and we'll do our Q&A out in the lobby.